Welcome to the regular board meeting of the Truckee Diner Public Utility District. It is Wednesday, May 1st, 6 o'clock. Could we get roll call, please?
Director Aguera?
Here.
Director Harris? Here. Director Laliotis?
Here.
Vice President Finn?
Here.
President Bender?
Here.
Thank you.
Hey, Joe,
Yay.
you want to lead us in the
Sure,
pledge?
I will.
Thank you.
See if I can stand up. Yeah. Everybody ready? Begin. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everybody.
Lisa. Thanks, Joe. Okay, number 4, changes to the agenda. Brian.
Yeah, I have a couple this evening. Oh, that's loud, sorry. I have a couple this evening, President Bender. In the interest of preserving time, if the board kind of so approves, staff's saying to, or requesting to pull the department updates. They were included in the staff report, and we have some workshops and a pretty healthy agenda this evening. But that'd be up to the board's decision on that. And then we'd like to move the workshop item to take place. This is workshop item number 17, to place that on the agenda directly after the consent calendar approval, or consideration, sorry, didn't want to presume approval there. And then finally, got the numbers here mixed up. Would like to pull item number 12, the action item number 12, the consider approval of the development agreement with Tahoe Donner Ski Hill. Pull that for, staff will bring it back at a different time.
Okay. I'm not seeing any shaking heads, so I think that sounds great. We'll make those mods for the meeting. Thank you. Okay, public comment, number 5. Time set aside for the public to address the board on any matter not on the agenda tonight. Is there any public comment tonight?
Back to number 4, I apologize, but is there any chance of moving item 16 up on the agenda? There are just a handful of members of the public here who are most interested in item 16.
Okay, so we could, we'll knock out the workshop and then we could move 16 in front of, or right after that, potentially. Then we're keeping all the action items together. Any board members opposed or want to do something different?
16 taking the place of 12, which has disappeared
Oh, okay. There we go.
right after consent calendar.
Great, all right. No, Brian nodded too. I think we're all nodding. All right, all right, okay.
Just for the record that we record that correctly in the minutes. So item 16 will be moved to the front of the action calendar ahead of item number 13.
Correct.
Okay.
Okay. All right. Any other public comment? And seeing none, we'll move on, and we're punting on, oh no, we have director update now. I'm gonna look over to Kim.
Of course, you know, what I always love to do, it's always my favorite time, is to thank all the staff, the crews, electric and water crew. I know we're going to be starting off summer here soon, and which means outdoor dig season, and it gets a little bit busier out there. But I just always like to thank all the employees for all their hard work and diligence in doing the right thing. And this is my appreciation moment. So thank you for allowing me to thank everybody.
Cool. Tony? No updates. I don't have any. Joe, any updates?
Nothing, no updates here at this time.
Krista Finn.
I do have a couple of quick updates on things that happened between the last meeting and this meeting. This morning, I zoomed in on the CCC meeting. I saw Stephen there and Alex also there. They're everywhere. That's the meeting where a lot of local districts, they all get together and talk about impacts to our region, mostly from the tourist season. And this morning's meeting was mostly about sort of fire season, what CAL FIRE is doing, what our local agencies are doing, how we're aligning our what the Forest Service is doing, projects that are underway to help us get through this coming fire season, hopefully as lucky as we were last year and the year before. Also, we had our Climate Transformation Alliance meeting the last Friday of April. No, somewhere, anyway, between, and that was a really great meeting, and we presented, we meaning not me, Stephen Keats, presented to the whole group our greenhouse gas assessment and really took a deep dive into that, which a lot of the attendees there were, I think, really appreciative of, to see really what a thorough greenhouse gas inventory looks like, upstream, downstream, our personal use. It was very impressive. We've received that. We saw that report earlier in this year, I believe in January. And it was a really good presentation. I was just very, very proud of the work that is being done here at the PUD and the attention that we are paying to all the things that we do at this point in time. And I just wanted to, adding on to that, April was Earth Day, and there's just a lot of good news out there, a lot of helpers, as Mr. Rogers would say, around the world. We're seeing all sorts of progress happening from federal guidelines streamlining the transmission, permitting of transmission lines through federal territories. More than 1 in 5 cars sold this year will be electric. China is adding renewable resources to their grid at an astounding pace, more than the rest of the world combined just this 1 year. So just all over the place, there's really good news. Everybody keep your spirits up as we continue to maneuver through these real transitions. So just thank you all for doing what you do.
Cool. Thank you.
Ditto.
All right. And we're going to punt till next meeting for department updates.
I do have one update to follow on the coattails of Vice President Finn in recognition of Earth Day. I neglected to mention in the staff report of department updates that the district was recognized by the town of Truckee in a form of a proclamation recognizing the district's efforts in environmental stewardship, climate mitigation through our efforts with the CTA, our own IRP that we adopted, as well as the work that was mentioned Stephen Keats has done with the greenhouse gas inventory and the energy survey. So it was we're very thankful for the town's recognition on that, and it was a formal recognition of the work we have done and continue to do in the future.
Awesome.
I forgot that.
Yeah. Thanks, Brian. Okay. All right, now we're on to consent calendar. We have a few items 8 through 11. Is there any public comment on the consent calendar tonight? All right, no public comment. Any questions or requests to pull from the board?
The one question I had, I just read further on in the document, and it answered it, so it's all good.
There we go. Perfect. Do you have a motion?
I do. I have a motion to approve the consent calendar as presented.
I'll second that motion.
All right, motion and a second. Could we get roll call, please?
Director Aguirre?
Here. Yes.
Oh, I did public
just a
comment,
minute.
yeah, at the beginning. Where are we at? Sorry, public comment, good. Director comments, good. Motion second, roll call. Joe said,
Yes.
oh,
Director
thank you.
Aguirre, sorry.
Yeah, I said yes.
Okay, there we go.
Director Harris?
Yes.
Director Laliotis?
Yes.
Vice President Finn?
Yes.
President Bender?
Yes.
Thank you.
Cool, thank you. All right, now we're moving workshop number 17 to the front. Emergency response and operation plan.
I thought it was 16 to the front.
Oh,
It was 16.
This one.
We're going to move the retirement action item to the front and then do the workshop and then,
Oh,
no, yeah, see, this is 17, the
Confusion.
workshop at the end.
my bad, sorry.
We were going to do that at the top of the action item list.
Which is now?
Well, we were sneaking in the workshop prior to the action item.
okay.
Yeah. Right.
What are we taking out?
Jillian's here, so
Okay.
let's just rock and roll. All right.
Good evening, President Bender and members of the board. Tonight, I'm here with Brenna Howell of Howell Consulting, who's joining us virtually on the screen back there, to present workshop item number 17, our Emergency Operations Plan update. I'll start the presentation with a little background and then hand it off to Brenna. And after we get through recommendations, we can answer any questions you may have. So in June 2022, the district hired a risk and compliance specialist. With this new resources added to the district, we were able to really spend some time diving into that department and coming up with a list of priorities. And an updated emergency response and operation plan was identified as a priority of the districts. So in June 7, 2023, the board approved a contract with Howell Consulting to update our emergency operations plan. Tonight's informational workshop will present an overview of the proposed emergency operation plan. This will be the foundation for our ongoing training, future workshops, development, tabletop exercises to adequately prepare district staff to respond in an emergency. And with that, I will turn it over to Brenna.
Good evening, members of the board. My name is Brenna Howell. Thank you for having me here this evening and allowing me to zoom in for the presentation. Go ahead, Jillian, to the next slide. So a little bit about us. We've been writing emergency plans and counseling local government entities in the field of emergency management since 2007. And our primary focus in that counseling and support to local government is the development of these required emergency plans and associated functional annexes, if you will, for special districts, cities, and county government. And then we also provide guidance and support to local governments during actual emergencies and into the recovery. All right, next slide. So what is an emergency operations plan? At its most granular level, it's basically a plan that describes and details what the district must do to be in compliance with state and federal law. It assigns the responsibilities for the staff within the district, sets authorities, who's in charge, under what authority do you have the ability to act in a disaster. It describes the protection that the district will do its best at during the emergency for their population served. And so in this case, it's for providing water and power. And then it also describes resources and how to get those resources, technical assistance, things that the government own, large generators, for example, and people. So next slide. So what is in the emergency plan? Basically, it's pretty much a 100-page document that describes all of the things you see up here on this slide, such as the purpose, scope, situation, and assumption. So we call that the front matter. The concept of operations, how the district's going to respond to an emergency. The organization and assignment of responsibilities, again, who does what and who's in charge, that becomes really important during an emergency. Direction, control, and coordination, that chapter focuses on the systems in which the district will respond. I'm sure some or most of you have heard of the incident command system or the standardized emergency management system, and then the national incident management system, and so that chapter addresses that. Information collection and dissemination is how are we going to take information in during an emergency and disseminate it out throughout an internal planning process. And then communications, how do we actually talk to people in a disaster? Text messaging alerts, phone communications, email, radio. And then administration, finance, and logistics, that discusses all of the recovery, mostly how we document what we did during the emergency, how we procure items, how we ask for support for things through the system, and then ultimately getting us ready for that recovery reimbursement if we're granted that through a state or federal declaration. And then describes the preparedness and the training and the exercising and the reporting that the district's going to do every time we have a disaster and before a disaster. So, and then plan development and maintenance, which is pretty self-explanatory. So we also, as part of this, developed an emergency operations center annex, which is all things about that room and how you utilize that room with your team and respond to that emergency, mostly coordination and communication, descriptions, things that you would need to run that room efficiently, and how you talk to other people. Next slide. So who mandates this plan and why? Really, it's the state and the federal government through the National Response Framework and the Standardized Emergency Management System here in California and the California Emergency Services Act. So all local governments, special districts, cities, and counties are required to have a plan. And really the hook for that requirement is if you don't have it and they ask for it when you're going through the recovery, they may not fund your recovery. In my career, I'm spanning close to 30 years and I have not seen that happen, but it could. And really having an emergency plan is really just a good thing to do. It provides structure and guidance to the staff and board members such as yourselves during an emergency and how to respond. Next slide. So how we approach this project, we kicked this off in, as Julian said, we signed the contracts and you authorized that contract in July. We kicked off the project in August 2023. We held a series of monthly meetings with the project team where we took a dive into the plan itself, looked at documents that you guys have had in the past, and some that were trying to be developed, and then came up with the plan that you have in front of you this evening. We attended the district day and did a series of presentations about what was emergency management in California. How does this plan apply to the district? And then completed several drafts, which the team reviewed thoroughly, I may add. So thank you so much for that. It's great to see the detailed response to the plan. So we incorporated those edits and then produced the final draft in February of 2024. And now we're here tonight presenting the final plan, hopefully for you to adopt. And then we'll finish it off after adoption by conducting a series of trainings for I believe the executive leadership team and the leadership team about what this plan is and how it applies to the district, with some exercises to practice some of the things that we've documented. And then we'll recommend future trainings and exercises, and then we'll look at the plan again in a few years. Next slide, Julian. So there's been a lot of changes in emergency planning over the last several years, and so the district staff that I've been working with thought it would be great to sort of incorporate all of that into this new plan. And since the Camp Fire, the Caldor Fire, and the other large destructive fires and disasters for that matter, winter storms that we've had, some of those changes have mostly been around focusing on people with access and functional needs, And there's been changes to the way Cal OES, which is the agency that reviews these plans, there's been some changes of the way they review them. There's been new federal and state guidance that's been implemented that we followed during this process. And then just more frequency in disasters and that everyone plays a role. Next slide. So you guys are really part of a larger system. This is the standardized, this is the foundation for the standardized emergency management system. And I like to show this slide because I want the district to know, and special districts, that you are a local government entity. And in California, all disasters are local. So if something's going on within your jurisdiction, it is your disaster and you're in charge of it. And you use this stair-step ladder approach to convey information and ask for resources and support. And so the system moves up and then it'll flow back down. And these are the different layers that you can go through to get that kind of support. The operational area is something that I like to provide education on to special districts because it's really your first stop for support from the state. And so the operational area in this case for you guys is Nevada and Placer counties. And it's basically all of the political subdivisions within the geographical boundaries of the county. And they maintain an EOC and they activate their operation centers quite frequently, especially in these two counties. So if you guys were to activate your EOC and say the town of Truckee would activate, then the operational area is automatically going to stand up and be there ready to support you. They also coordinate information between all of their cities and jurisdictions within the county, including special districts, and they prioritize resources. And then if they don't have them locally, they ask for those resources to the Regional Emergency Operations Center, which is basically the state of California. So Nevada and Placer counties are there to support you, and likewise the town of Truckee. And so I just want to bring light to that you're not at this alone and there are resources there to support you. And I think that is it for now. It's been a great project working with the team at the district, and I thank you for your time. And if there are any questions, I'm happy to stay on and answer any.
Thank you, Brenna. So for fiscal impact, there is no fiscal impact associated with this item. And our recommendation is for the board to receive this presentation and provide input to staff. And as mentioned, we're available for questions.
Great, thank you. All right, any public input on our emergency operation plan? Okay, seeing none, any comments or questions from the board? Yeah.
Thank you very much for putting this together. I mean, when you're in a state of emergency, I know everybody gets kind of panicked, and I think it's awesome to have a base to go off of. And I'm also glad at the very end that you did mention the partners with Town of Truckee as well as Placer and Nevada counties. There's also, other small jurisdictions that maybe need our support too. So just making sure that we are kind of supporting each other on this endeavor. And I don't know, I think Bob Womack is still in charge of the one in Truckee. So hopefully he's able to, I don't know if he made suggestions or making sure that you're coordinating all that. I see this nodding yes, Jillian has a smile on her face.
Yeah, we did coordinate the plan with Bob Womack. I've been working with him for years, so it was super easy for us to do that with him. And I actually wrote the Town of Truckee's emergency plan as well.
Oh, easy enough. There you go. Well, I'm happy to hear that it's all getting coordinated, that no one's operating in a silo.
No,
So,
yep.
and that there's bat phones, I guess, but I think Bob Womack called it the Bob Womack, like, bat light, where Batman comes and, well, whatever. He has, but thank you.
Tony?
Thank you. It's great to have
these programs, vetted with a consultant who does this all the time. And then also putting together a plan to do exercises, tabletops, because oftentimes these plans just sit on the shelf and, and gather dust. But I do have a question, just quick. I know, just from my past experience, a few years back, we were required through the OWIA, American Water Infrastructure Act, to for public water systems serving over 3,300 people, to have an emergency response plan and a couple other elements which were required by the act. Is this serving as that document, or do we have a separate document that covers that?
Do you want me to take that, guys?
Go ahead.
Yeah, go ahead, Brenda.
Yeah, so this is not that document. That is an ER emergency response plan that, you're right, they were required in 2018. And my understanding is that there is one already in the district that has been completed.
Okay, and is there any overlap between the two documents?
They're coordinated documents as well. Those, I've written a few of those ERPs in the last 5 years. They're more focused on the water systems and how we're gonna keep water flowing to customers in a disaster. Same system would apply here, though. If the resources weren't available to the district, then the global emergency plan and the processes contained within it would go into action here to support the water delivery.
Great, thank you. That's all I have.
Cool.
Joe?
Hey, have we started any proceedings on having a plan, or do we have a plan now of any kind?
So this is the plan that we're reviewing, that we just finalized with Brenna. So we're presenting that today, and staff is going to go through a series of more in-depth training to the plan, and later in the month of May. And we'll be doing, where they review the plan in depth, and then we'll be doing some exercises with them as well. And then we'll do future training, more drills, position-specific, to really make sure that we're prepared for an
Yeah.
emergency.
So we have started this project.
Yes, absolutely.
Oh, that's good, okay. That's fine.
Cool. Thank you,
Yeah.
Joe. Krista Finn, any comments?
Echoing a lot of the same, thank you for the work that you're doing for us. It was some pretty dense reading, and I am glad to hear that we will be doing actual, putting those words into actions. It's hard to envision it sometimes when you're reading the documents, but then to see, to role play or whatever it is that you're planning. Not that I look forward to participating in it at all, but, or any of this happening. None of us likes to think too much about this, but having a plan is incredibly important. Practicing the plan is incredibly important, because the manure does hit the windmill often enough. It's good to know what you're doing when that happens. You're not just panicking.
Right.
So thank you. I appreciate everybody's efforts along these lines.
Ditto that, please. So, excellent.
Now, Julian, I have one more question there. And when we're done with our information and gathering and meetings, is there a membership to this? Is this a state of California agency?
So this is our plan, and Brenna's a consultant that's helping us understand how we play into the larger kind of system. When this rolls up into emergency warrants, it kind of moves through that ladder, the slide. And so we're part of that already. We're part of that system.
Oh, okay, good. Oh, okay. So we're in the operational plan right now?
Yeah.
Good, thank you.
Excellent. Okay, I think you've got some input now. Excellent. Thank you very much for the work, and great. Excellent. All right, we'll move on now. We're moving item number 16 up to the top of the action item list. And that is, shoot, I'm just all over the place with the agenda. I don't know, oh, because I'm at the, yeah. Okay, we have District Code Title IV, Post-Retirement Benefits. That's what I wanted to read, number 16. Thank you for everyone for hanging in there. as we went through with our consultant workshop. And Brian, you've got the,
Good evening. As you mentioned, President Bender, this is action item number 16 related to District Code Title IV. So I want to go through a little bit of background before we open this up to discussion, a little bit of background on the item and kind of how we arrived where we are this evening. So kind of the obvious overarching detail here is that District Code Title IV personnel codifies group benefits for all regular employees who are not represented by a union memorandum of understanding, as well as other personnel policies. So District Code Title IV addresses all the personnel items, including group benefits, salary, wages, medical, vision, et cetera. The unrepresented employees group compensation negotiations, in those negotiations, certain benefits changes are proposed from year to year. So the represented group, the union, IBEW 1245, negotiates an MOU that typically lasts from 3 to 5 years. The current MOU was negotiated in 2020 and expires at the end of this year, where the unrepresented group tend to negotiate revisions to benefits and compensation either on an annual basis or maybe on a biannual basis. And so back at the board's meeting on the 26th of March, staff presented for board consideration, it was item number 14 on the agenda, consideration of approval of employee benefits changes. The proposed changes here are outlined. This is from the March 26th agenda. And you can read these here. They're kind of five benefits changes related to vision. The vision benefit increased from $400 to $500 per employee per year and their dependents. There was a recommendation to specify that the increase in vision benefit plan was for retirees effective after January 1st, 2024 or later. I have that highlighted in blue because that's going to be the subject of discussion this evening. The other changes that were included in that agenda item were reducing the minimum accrued sick hours from 600 to 500 hours for employees, district increasing the 457B district match by 2%. This was to address the equity issue between the classic CalPERS and the PEPRA benefit employees, and then increasing the administrative leave benefit from 9 days to 10 days. So at the March 6th meeting, the board evaluated each of the modifications to employee benefits as proposed and approved all except for item number 2, the modification of item number 2 related to the post-retirement benefits. The board has previously reviewed this subject matter at a meeting that was held back on May 20th of 2020. That's too many 20s, 2020. The board made a determination in response to a letter of referral. That's a technical name for a grievance that was submitted by the IBEW 1245, disputing the district's interpretation of post-retirement benefits outlined in the recently approved Memorandum of Understanding. Duplicate at the top there. So the board made a motion and approved staff's recommendation to reject the grievance submitted by IBEW. The board feedback at that time, back on May 20 of 2020, was that staff's interpretation of the MOU and District Code Title IV was correct. Negotiated increases in employee benefits were applicable to current employees, future retirees, and not previously retired employees. At the most recent meeting, March 6th of this year, the board requested that staff bring this item back for further consideration and deliberation, providing the opportunity to fully review the issue, examine some of the past discussions included in the board packet that was on this agenda were some of the minutes and board items from that May 20th, 2020 meeting, and also take into consideration some financial impacts. So we're going to go through a little bit of the fiscal impacts, and this is kind of comparing considerations if things were kept status quo or if the board made a determination to include previously retired employees in the recent adjustments. So the application of recently negotiated changes to employee group benefits was not included in the district's fiscal year 24-25 budget. As of January 1st of this year, there are 48 retired former district employees actively receiving post-retirement benefits. Including their dependents, there are 88 qualified recipients of our post-retirement benefits. And so the district's total cost of active participants in post-retirement benefits are as follows. So from a medical benefits perspective, the total annual cost of current participants prior to the application of an improved increase is just under $380,000 a year. The estimated total cost of current participants, including the application of the increased benefits, would be about $460,000 a year. So it's an $81,000 a year increase, about equivalent to a 22% increase in total annual costs for the medical portion of the post-retirement benefits. And this is based on the current qualified recipients of that benefit. There's no projection here of what it would be with future retirees. And so for the vision benefit, the current post-retirement vision care payment is about $12,000, just over $12,000 for 2023. The estimated cost based on historical data of who participates. So again, the vision benefit is not something everyone participates in. Every employee and their family and post-retire employee and their families eligible for the benefit. Based on the 2023 data, if the increase was applied to previously retired employees, it would be about an annual cost of just under $17,000 a year. And so that's a $4,700 increase, equivalent to a 38% increase in annual cost. So adding the two, medical and vision, you can see at the bottom there that the total increase in annual costs would be about $86,000 a year. That's an estimate based on the current data we have. One of the things staff would like the board just to have the access to and consider here is that the overwhelming majority of current retirees participating in post-retirement benefits are CalPERS Classic employees. And so this shows the continued increase in the unfunded liability for the district. It's at just over $1.4 million per year. And so the addition of additional benefits would add to that unfunded liability as we start to have more people retire and continue. So for consideration this evening, staff is presenting two options for recommendations. Again, the board can modify these or come up with other recommendations, but after consideration and deliberation, these are the two kind of basic options, but obviously can be edited. First option, approve a revision to District Code Title IV personnel as proposed on March 6th, 2024 to limit the eligibility of a negotiated employee group benefit adjustments made effective January 1st, 2024 to current employees and those who have retired after January 1st of 2024. The other option, approve a revision to District Code Title IV personnel to make current and all retired employees eligible for negotiated employee group benefit adjustments made effective January 1st, 2024. And I'm happy to answer any questions or provide additional data. So I'll hand it back to you, President Bender.
Great, thank you. All right, so now is the time for some public input. I think one or two buttons.
Now?
There we go.
Okay.
Perfect.
Good evening. My name is Stephen Hollabaugh. Good evening, Board. President Bender. Let's
Good
start with that.
evening, Steve.
I'm a retired Assistant General Manager, Electric Utility Manager, and Power Supply Engineer. And yes, all three titles were on my business card. I worked at the district for just short of 25 years. I was personally involved in 8 MOU negotiations with 2 general managers on the management side. I worked with 2 general counsels, John Phelps and Steve Gross. Tonight, I want to talk about retirement medical caps and some history and some things there. I've handed out 2 attachments. I'm going to just refer to those. I'm not going to read them to you, but I'll get to those in a minute. First, I want to state, I've never been represented by a union, an MOU, and never will be in my entire career, my 35-year career within the electric industry. I want to talk a little bit about past practice in the district here. When I started the district, I had some, say, wild ideas and different things I wanted to do, and I had to be reeled in, I should say, by district council on past practice on how things are done. So I learned. So in past practice, in 2003, the district negotiated with the union and approved increased retiree medical caps. One of the attachments, attachment A, there's two parts to it. The second 2 pages is from the union, and you'll see there, it just says one of the items is increased retiree medical caps. That's all it says. And it was signed by Pierre Holzmeister and Randy Osborne. The front page is the red line of the district code from the resolution that was approved. So in 2003, okay, the union and the district approved increase in retirement medical caps. This does not mean the union negotiated for unrepresented employees or retirees. The district board then approved an updated district code in 2003 to increase caps from 350 to 475 for all employees, unrepresented employees, union employees, retirees. This was a board decision. This was not a negotiation. This was a board decision for the board basically to treat all retirees fairly and the same. So this is a past practice and should be taken into consideration. Past practice matters, and it should be taken into consideration. 2020 actions of the board. The board approves district code changes by resolution. These changes replace all preceding resolutions affecting such title. And that is said in every resolution that updates district code. There's not 2 district codes. There's 1 district code. If you update a section, that part's gone. You only have 1 section going forward. On March 18th, the board approved Resolution 2020-09, amending District Code Title IV. That resolution did the following. It brought the district's policies up to date. It replaced all preceding resolutions affecting such titles and updated post-retirement medical benefits for all. At that time, the current district code, which was amended there, changed the monthly caps retirement medical from 475 to 600. It does not talk about dates of retirement. It's the exact same way past practice was done back in 2003. I sent a letter to the board dated March 26, 2020, and that's attachment B, basically thanking the board for its actions on behalf of retired employees. This letter outlines the board actions of that night, and everything in that letter is still valid today. And it lists the board members that were on the board at that time. This is the actual letter I sent back in March 26, 2020. Okay, this issue got confused with the union grievance, and that's kind of why we're here tonight. The board received information, staff presentation, about the union grievance in May 2020, which Brian talked about. And the board rejected that grievance submitted by the union, the IBW. I agree 100% with the board's action. The union does not negotiate for unrepresented employees or retirees and never has. That is past practice also. So you are 100% correct in what you did by basically getting rid of that grievance, denying the grievance, and moving forward. But the board's actions that update the district code is for all, and that was already approved. And that is still the current district code. So the board's actions of Resolution 2020-09 still stands as approved from the March 18th, 2020 meeting. And that also follows past practice of what was done in 2003. Cost to the district. At a recent board meeting, March 6, 2024, the board updated the PURPA and stated that 69% of its current employees are under PERPA and 31% under Classic of current employees. PERPA went into effect in 2013, so that tells me almost 70% of your employees have 11 years or less with the district. So most of your employees aren't going to see this benefit until another 10 years, till they get to 20 years of service to see the full benefit before they retire. So you're not going to have a lot of current pressure for people retiring. There are some that have over 20 years. I think I hired a few of them. There's a couple that I know of, but I don't want to name names. So there's really just not a lot of exposure, is the point I'm trying to make there, to the district in the upcoming years to this cost. Now, the district costs go down 4 ways by the board doing absolutely nothing over time. One of those is that an employee decides to leave the plan on their own, and they cannot come back on the plan if they leave the plan. So once they leave, that cost is gone to the district. Employees' children when they become 26 years old, they must leave the medical plan. So as time goes on, children get older, we all get older, as you can see, and the cost of the district goes down as those people are dropping off. The third is when employees become 65 years old and must join Medicare, the district cost is reduced from $600 to $500 under the current district code. So there's another 20% there. The fourth, unfortunately, people pass. Peter Holzmeister, my wife Donna, passed away in 2023, just to name a few. District costs for myself have dropped substantially in 2023 due to my son turning 26 and my wife passing to heaven. The costs will lower in 2025, again, when I turn 65. So please follow past practice and keep retirement medical as it is for all. So I shouldn't have to ask the board to instruct staff to follow district code, but that is what I'm asking. Under the current district code, it's $600 for an individual, and we've been getting the $475 because of the confusion on the basically argument of whether union has a right to negotiate for retirees. The current district code has been approved and has not been changed. So I'm asking you, respect the work the retirees have done for the district. Many feel disrespected making 2 classes of retirees. It just doesn't feel right. For example, there's a couple people here who have more than 20 years who have retired. Becky has 26 years with the district. She retired in November of 19, and 1 month later she would have gotten $600, but now you're giving her $475 for medical. Does her 26 years mean different than, my 25 or someone else's? It doesn't feel right, it doesn't sit right. The board members have said they are appreciative of employees that work storms, keep the power on and water flowing. Your actions mean more than words. I respect and appreciate employees, and I'd like to see that with the talk tonight. I can answer any questions the board may have. Thank you for the time, and I will give my talking points to Brian just for the record. They're in real big print so I can read them. So if you have any questions, I can either stand here or go sit down or whatever you want me to do.
Great,
In the meantime, I'm going to give this to Brian.
thank you.
But there may be others to talk, so I'll sit down.
Right, all right. Thanks, Steve. All right, any other public input on this item? Yeah, go ahead. Yep, yes, please.
Is this still on?
Yep.
Yeah, my name is Becky Mazer. I did work for Truckee Donner PUD for 26 years, most of those in the billing. I was the billing clerk, customer service before that. I agree with Steve, and I just want to say that at the point that I retired, I was under the impression that changes will also apply to retirees. It's written in the district code, written in the MOU. I mean, there's different and I was a bargaining unit employee. Anywhere I looked, I was under the impression when I retired that any changes, for better or for worse, would apply to me also. Had I known I was going to be dropped off as a different class of retiree, I would have worked another month and a half, gladly, for Truckee Donner PUD, because I did enjoy my time here for the most part. I would have worked an extra month and a half and not be affected by, by what happened here. So I don't believe there should be separate classes of retirees. So, thank you.
Thank you. We're all staring at you. Jim, do you want to just step up and say hi?
Yes, yeah.
It is my 65th birthday today, and so we moved to Nevada City. I moved up to Reno. We moved to Nevada City. We came up to Reno to spend some time up there and see our son, who's the emergency manager for Story County. And so we spent the day up there, and we're just headed back. Said, we have time to stop at the meeting. I've got to stop. So, hello, everyone. Thank
All right,
you.
hello, happy birthday. All right. Okay.
That was a good speech, Jim.
All right, any other public input? Okay, we'll get into the weeds here. This is why we put it off to this, so we could dive in deep. All right. Whose mic was that clicked? Oh, that was Brian's. All right. Tony, do you want to start us off with?
What number are we on finally?
Yeah. Kim and Krista are avoiding the mic. So for now.
I'll go, but I wasn't here when this originally went down, so I figured that you all wanted to talk first, and then I'll see what, I'll feed in information as needed. Because this was a program that I actually used to manage when I was here.
Oh, okay.
Got it. So, sure, I'll start off. Thanks for everyone coming here tonight, and Steve, thank you for the history. And I don't dispute the fact that past practice did include, increases clearly were attributed to retirees at certain periods of time. I did take the time last night to actually review the video of the meeting in May of 2020, May 20th, I think, 2020. And, I feel strongly that the board took very clear and decisive action to indicate and spotlight that the increases to post-retirement medical were for employees after a certain point, which I think was January 1st, 2020. So I feel strongly that I was not unclear about that action that we took, and that was the way that we perceived it to be. I understand the way district code is written does not necessarily support that decision in a written format, but I would maybe ask district council to clarify that what's codified and board decisions don't always necessarily have to be in the same realm. Is that true, Steve?
That's true. So the district code is simply a compilation of district policies. We're not required by law, by the Public Utilities District Act or any other law to have a code or a codification. But that's how we refer to it. It's our code. It's been here longer than I've been around for the last 33 years, and probably longer than Steve and Becky were around. It was probably here. And it's a compilation of policies. And when the board takes action to adopt or change policies, the codes or the policies that are in those codes should be updated. They're not always updated immediately. Sometimes there's a lag. In this case, there's a long lag period. But I don't think that what is written in those policies in the code is dispositive. What's dispositive is the board's action. And clearly, at least from my review of the records that are here tonight, and that Mr. Hollabaugh provided, the intent of the board in 2020 was to clearly state, at least at that time, its intent to limit the increase in retiree medical benefits to current and future retirees, but not past retirees. So, long answer to your question, Tony, but I think what's dispositive is the board's most recent action. And then we try to bring the code or bring those policies up to the current state of the board's action, okay? And just one other point while I've got the mic. Mr. Hollabaugh handed out two documents. One is marked as A, and he referred to that. And on the second page, he referred to an IBEW document titled Statement of Committee. And it clearly says that, this is in 2003, the district and the union negotiating committees came to a tentative agreement, and listed in that document are all the terms of the tentative agreement. Included in that is a, quote, increased retiree medical caps. So when I read that, what it tells me is that clearly the district and the union negotiated at that point in time an increase to the retiree medical caps, and it was very clear in the documentation. So at least as of 2003, everybody knew how to document that intended change. And that same kind of documentation wasn't in the 2019 union negotiations and the MOU that resulted from those negotiations. So I appreciate the reference to past practice. And in this case, past practice, it was clearly documented that the terms were negotiated. That doesn't seem to be the case in 2019. So, Tony, I hope I answered your question.
Yeah, no, thank you. So, so when we took this item up last month or 2 months ago, the goal of what I was trying to accomplish was not to say what we did was wrong, but was to say that should we as a board look at this post-retirement medical benefit for retirees prior to 2020, should we look at or consider a cost of living adjustment to that number? Meaning, you know, and like I said, we didn't do anything wrong. I think we were very clear that we weren't going to apply that increase to retirees previous to 2020. Things have changed. 4 years post-COVID, 12% inflation, you know. So what I was trying to accomplish today was not to necessarily give retirees another bite at the apple, but you're welcome, but was to discuss as a board, is that something we want to consider? And as I said, I don't believe we did anything wrong. I believe we were very deliberate in our actions and I was very clear, and I went through the video again, and I will add one other item. At the end of, close to the end of that discussion, Bob Ellis goes, well, maybe the board can bring this back at some point and have a discussion about it. And so I kind of laughed when I saw that, because here we are 4 years, almost to the day later, and we're here talking about what Bob Ellis mentioned. So I want to be clear that this was really, I'm one board member. There are 4 other board members. This is a topic of discussion. Some of us may feel strongly that yes, we should. Some of us may feel strongly that no. We made that decision and we're going to move forward. But I wanted to bring it up and have a discussion about it. So that's where I'm at.
Nice. That was a good kickoff. I'm glad I picked you.
Tony, now, the people that got this benefit from our last meeting, from May 20th, are the only ones that got the benefit. There was no other, back before that, there was no benefit given to the retirees, right?
Well, I think before 2020, increases to the retiree medical caps were given to all retirees at the time.
Oh, they did get this benefit also?
Yes, and in 2020, though, I believe we made the conscious decision to, the changes that were proposed and made in the MOU in 2020, that we made the decision that those were not going to be applied to retirees prior to January 1st, 2020, only to after. So that's,
So they're not included, all the retirees are not included as of January 20.
yes, so in January 2020.
Just the ones that retired from 1920.
From 2020, the retirees in 2020 are receiving the increased benefit. The retirees prior to 2020 receiving the benefit that was approved prior to that. I don't remember what MOU was the last one.
It's hard to track.
Yeah.
Yeah,
I feel ya.
it's hard to track. Well, there was the code read something and was written something else, but the second code wasn't written.
You mean board action
Yeah,
was taken and we haven't updated the code
yes.
yet?
Well, we haven't updated, we updated at that meeting. But it's only for the retirees after 2020.
So after the negotiations that took place at the end of 2019 for benefits to be applied 2020 and beyond, the district had intended to bring an item to the board. I know that's intention isn't recorded or it's not part of the board decisions or record making. But then there was a grievance filed by IBEW based on staff's interpretation of the recently negotiated MOU. And so that was brought in front of the board. The union was taking a position that all of the adjustments to post-retirement benefits were applicable to all past retirees who have qualified dependents and all future retirees. The district's position was that based on the negotiations in good faith with IBEW, that they represented union members within the district, and so that those changes were applicable to anybody who retired after January 1st, 2020. The board made a decision or determination in that meeting to reject the grievance and uphold, as Director Laliotis pointed out, uphold staff's interpretation of the MOU. Subsequent to that decision, and based on the discussions the board had, the general manager at the time felt there was no need to make any further adjustments to Title IV because the board had already made a determination. What staff is presenting this evening, based on the kind of resurfacing of this discussion, as Director Laliotis pointed out, Director Ellis predicted this discussion would come back, and we're here again. So staff's proposing, do we want to codify it in district code, as Council Gross talked about, or do we want to modify it to include, or make sure it's clear, put some clarity in district code, who's eligible for this increased benefit?
Well, I think that the benefits go to the employees, and I think that all retirees should get it too, past January 3rd. I thought that everybody, all our retirees are gonna get it, but I forgot about that. May 20th, that came in there,
I think,
of 20, yeah.
yeah.
Just one other point I want to make is I heard concern about two classes of retirees, and I can guarantee you that almost every agency, in fact, any CalPERS agency has two classes of retirees. And I would argue that there will likely be 3, 4, 5, 6 classes of retirees as we continue to move forward at this time. So I understand it doesn't seem fair, but it is a reality that all public agencies are going to face moving forward and when they go into cost control, as you can see for post-retirement benefits, is creating multiple classes of retirees. So it's just the way it's going to be, unfortunately, and the way it already is in a lot of places and everywhere practically.
All right, I'll let Tony off the hot seat for a minute. I wish I had had the thought to actually watch the meeting. I, of course, read all the documents, but it didn't occur to me to pull it up. But what you said tracks with my memory, that we made a deliberate decision, and that not a lot has occurred between then and now. I mean, a lot has occurred between then and now, things like COVID and inflation, but other things are still consistent. I have concerns about every decision we make going forward in negotiations with employees, represented and unrepresented, becomes retroactively applied to every retiree. Costs are serious. You're right. All of you are right. The medical costs are expensive. They're rising for everybody. They are rising. All of our insurance costs for the district are, insurance for fire, insurance. These are what we need to try to keep a handle on. And I know we have had numerous discussions about our current employees and the medical plans and the benefit packages that we are putting together, and how are we going to contain costs while still maintaining the health of our current employees. It's not easy, is it? But I think that is paramount, that we keep that in mind. And what we do, I think that everybody should get the best of everything all the time. I think we should all have amazing health care. I think that's why every chance I get, I vote for people and policies that push those things forward. But that is not what we do at the PUD. We provide utility services, and we have lots of retirees in our district, not all of whom worked for the PUD. And I feel like it is our obligation to this community, our responsibility, to keep our costs across the board down that show up in their bills. Our ratepayers are paying for all of this, for everyone. So if we keep our utility bills as low as we can for everybody, I feel like that is the highest good that we can do for all the vulnerable people in our community, not just our seniors, but our children, our people with disabilities and other challenges. And I have concerns about every decision we make going forward being, I feel like that's a can of worms or a slippery slope or all the cliches that, once we say, well, we increased this cap moving forward, we are changing the amount of hours that you can sick leave, et cetera. Well, are we going to have to refund that to people previously that didn't have, we made that change and now it should be retroactive? I know, you guys are shaking your head because it's ridiculous. Because it's ridiculous, that's right, that's not how it works. We only move in one direction, we only move forward. We can't go backwards. And I feel like we try to take really good care of all of our employees. We try to take good care of our retirees. You have really wonderful health care here. You have really amazing pension plans. These are not things that most of us have access to ever. We have to plan for a time, and I will never retire. It's just not possible. It's not possible. Small business owners don't retire. We just die. So, that's the way out. So I feel it, I do. I feel for everybody here, but I also feel like our mission is to provide quality electric and water. We're not a social services entity. So I feel like there are resources available, I'm looking at gaps, keeping my fingers crossed till I turn 65. That's my plan. So I feel that all of us, we need to try to do the best we can to plan, to take some personal responsibility for ourselves. So anyhow, I don't know if that made a lot of sense, but I feel the decision that we made sense to me, and it still makes sense to me. That's, in a nutshell, where I'm at.
Right, because, when the 86,000, if we just round to 13 million a year for electric rate income, that's 0.7% of a rate increase, or a rate, just of that income for that. So it's something.
It is something, and people certainly speak up when we increase the rates for any reason.
Yeah.
And that doesn't stop us from doing it, because we have to do what we have to do.
You want to provide some input?
Yes, thank you for all your comments and everything. So I respect the fact that you guys had the discussion and it had been clear to set the date from when this increase would happen. It's always surprising to me when somebody is so close to retirement and they don't catch wind of something like this. So they can make an educated choice based on future medical costs she was here for 26 years, and just to wait another month and a half and not to hear it at all, and then all of a sudden it's kind of like slaps you in the face, and it's like the company that you have put your blood, sweat, and tears in, and your support in, and it has a great base for future, future employees to prosper and to benefit from all of their work, and the community has benefited from their work. And but I also respect the fact that's how it kind of came out at that point. I think we have a wonderful opportunity right now, because if when you're recruiting people, or when people are This is a great program to have retiree insurance. And one thing I think that the district did well is that they didn't say, we're going to pay 100% for your insurance. Because if they were paying 100% of the premiums, that would be a big ticket item. Since 2020, I expect the insurance costs have gone up probably at least 50%, I don't know, for a family of four or for a single person. Do you know how much they've increased since then?
I don't have any numbers for what medical service has increased over the last years. I just had a question. Were you referring to the employee contributions to CalPERS or their medical programs?
The medical programs.
So we've only recently added in that last negotiations where staff had to add $50 a month contributions for future plans for staff to start contributing to the increase in medical care costs. That didn't exist prior to 2020.
Correct.
Okay.
So with that, the retiree insurance, these are caps. And so employees that are here less than 20 years pay a portion of that cap, and that cap goes down. So not everybody gets the $600 a month. If you're here only 10 years, it's half that, $300 a month. So depending on how, the people that have been here the longest, yeah, they're probably getting the max caps because they've been here 20 years at least. And so they're 100% affected by this, the not giving them the increase, but, 1 month, seriously, 1 month before she retires and this changes, like it's just such a shame. I just feel that the district has an opportunity here. And granted, ideally, I'd love to see this program get backdated, but I think the board was from what Tony said, was very clear at that meeting on the dates that it got implemented. And it did start to come up because of the vision insurance. The vision insurance, we want it to go up $100. And from what I said at the last meeting is, retirees are now on a fixed income. And there has not been any cost of living adjustments for these contributions. They have shouldered 100% the increase in the cost of the medical, and I believe dental insurance is included in this too. So they have shouldered the 12, 15, 20% increases over the past years because their contributions hasn't changed. So I think it's important that to manage the district's retiree insurance, the district did put a cap on it. Like I said, they're not paying 100% of it. And I think that honoring what has been in district code the last 4 years, it's in other parts of district code, there are dates associated with CalPERS. PEPRA it was very clear that January 2013, everybody's going on to PEPRA, and it was clear in there. In district code for the last 4 years, if you walk over and you say, okay, it's a cap of $600. Wait, somebody's only getting $475? I don't get that, but it doesn't say any here, and it's not written clearly. Even though the board said it, it wasn't clearly stated, and there's opportunities to improve that. So I would like to propose that we keep all the retirees as kind of a retiree package and keep it consistent from this point forward and give them the $500 increase in vision, as well as honor the monthly caps from this point forward for all the retirees. One of the questions I had for you, Brian, is you mentioned that there's 48 retired employees right now. Do you know what percentage are from prior to 2020? Like how many people are still on the 475 a month?
I don't have that data readily available. We could come back with that.
Okay. Really, how many people does this affect? Sadly, Steve pointed out that Peter Holzmeister passed away, his wife passed away. There's dependents that age out of it. And of the 88 dependents, is that all the kids? If people have 4 kids, are 4 kids included in that? Or is that the families with 1 kid? Is that one dependent, or with the spouse and the children? How's that kind of calculation out? I just feel that if we honor at least this $600 cap for the ones who are already existing, even though they missed out on the last 4 years, they've been shouldering all of these increases in insurance and everything, that it's a small token of what we can do kind of from this point forward and getting everybody onto the same page. So that's what I don't know if it's a motion or if you want to keep discussing, but that's my 2 cents is cost-wise, I think we owe it to 25, 26-year employees.
So do I.
Becky, I don't know, Becky had a question.
I'm retired.
Well, I just kind of want to get through all our discussion first, because we may answer the question or not. It's really tough, because if I were in the retiree shoes, I definitely would want it,
Sure.
So this is,
They were retirees of the PUD.
Right. And then on the other hand, I want to, Kim, you've always been a financial hardliner. for a couple of, for 3.5 years. So, I want to do our best to control the rates, and I always think of this song by Live, and it's, I think the song is called Waitress, and they talk about change, just some change. And so in the grand scheme of things, it's not a lot of an impact to the district. And so I just think of that song, can we afford to do this? Because if I were in their shoes, I would definitely want us as a board to make that decision. And I'm still, I want to be fiscally responsible and control rates, because just with this one decision that we're making, now we're now deciding for many years to come, basically, that's 1% of our current rates right now. So, or plus or minus, based on the numbers. Yeah. Tony, where are you at now? Are you leaning more?
I said where I was at. I said I wanted to have this board discussion.
Yeah, we're having it. Yeah, we're having it. So.
And one thing I did, it's not hugely impactful, but I do recognize that, during the 2020 MOU discussions, the union did agree to contributions towards medical of 25, and I think it's increased to 50 a month now. And so, there is a difference in that. And, obviously the door's open, and I think, moving forward.
You're
the
gonna
district
turn
will
50, did you say?
50.
You're gonna turn 50?
No, Tony's way beyond that.
You're really older than that. I thought you said, I'm gonna turn 50.
Anyway, no.
I got my hearing aids on.
I recognize the fact that there was some give and take in the last negotiations, and that, while $50 isn't a ton of money, it's a door that we were able to open as a board and staff to, working towards further cost recovery for future medical costs. And we are not asking retirees to pay that at this time either, so. Just another point.
So what do we do?
But,
Put it to another meeting?
I think we
and
had
vote on
a
it, or-
question from Becky.
What's that?
I may, this.
Yeah, Becky's been
This will be
patient.
quick.
Oh, okay. All
One
right.
minor detail, Jim today, and I've been 65 for a few years now, or I turned 65 a few years ago, our benefit then dropped down to $375. So it's not the full $475 anymore, it's $375 a month benefit. And then my question for the board was, in 2020, during that discussion where you presumably put a starting date on that $600 benefit, was there any part of the discussion that addressed why? Why are we targeting this particular thing that we want to drop some people off of this very particular thing? Were there not other things where we could have saved some money, maybe even bigger money on some other areas? And there's 48 people, 48 to 88, depending on who you're counting. And like Steve said, those people are going to be dropping off. So it's a known dollar amount. It's a known dollar amount, and it's only going to get smaller as time goes by. So that's my 2 points. Thank you.
Thank you.
Am I on? Yeah, so, that's a great point, is it was 600. Once you turn 65, it goes down to, these are the new rates, 600 to 500. And I'm just going from individual only down to Medicare rate. So it drops down just by getting older, and the district has capped it. So like I said, I am for keeping the retiree insurance the same for retirees and honoring what has been written in district code, because the dates have been, I know they were agreed upon by you guys, but it wasn't reflected unless you watched the district meeting that day, you wouldn't see that in anything. So I just think it's a great opportunity from this point forward to kind of learn the lessons that can bring more clarity to district code and to retirees. And I mean, they worked 26 years, and I personally think it's worth it, so.
My concerns are not about this current group of people and how long we're going to be. It's just, the next time we do this, is it going to be retroactive? Again, the next time we raise the caps because we know that health insurance is just going to continue to go up, and we will have different retirees at that point, and will it be retro, that will be the expectation
We're
moving
not
forward.
doing retro, right, just to make that clear. We're just doing it as of January 1st, 2024. We're not going backwards.
I gotta say, I would love to retro it, but I think based on the discussions of what Tony, and I didn't watch the meeting.
Okay.
That, I mean, I'll go with what you guys said about starting on a certain date, forward, but we now have the opportunity to reopen it up to include people like Steve and Jim, and include everybody, and just have one retiree package that's for everybody. And that includes the increase in the $500 to the $500 for the vision insurance, and then for the people that are still in the 475 group, just bring them up to 600. So now you have all retirees in one, with the same consistent
I
benefits
understand that
listed
part.
In the district
I
code.
understand that part.
Okay.
I think my concern is thinking into the future. We might again decide that we should be raising the cap for future retirees. And in that case, everybody who's retired at that time, who was previously retired, say somebody retires and say we do this in 2026, and somebody retired in 2025. So that decision, again, will raise everybody up
But I think
to the new cap. Is that
but communicating it
Correct.
better to people so they can decide if they want to wait the 2 years retirement.
I don't think we know what's going to come. I mean, I didn't know this was coming in front of us at that
Brian
2020
has some
meeting.
light to shed.
And again, this is a board policy decision, financial policy decision. And so just for the board has everything for consideration. Just a reminder that the employees represented by the MOU fall under a different benefits package than the employees who are not under the MOU. So there is a chance, a circumstance, where IBEW could negotiate a different post-retirement benefit for their represented employees than what the board makes a decision that's in district code. So they're not mutually exclusive all the time, because sometimes represented employees negotiate an MOU and the unrepresented follow suit. And that has been a historical pattern that has been convenient, but it's not necessarily going to always be the case. So just consider that as the board starts to set policy moving forward. Is this a one-time reset? Is it a future policy? Because we're going into negotiations this fall, and there may be a different negotiated package. And so as you've had from public comment, you have both represented and unrepresented retirees who fall under different provisions, one under the MOU at the time they retired and one under district code.
So let me ask a question, to you, Krista. So we're going to be entering negotiations for, at some point here. So if the union requests an increase in the cap, okay, and then we say, yep, that's okay, but it's retroactive to employees from January 1st, 2025 forward. So the people who were, retire between 2020 and 2024, you're saying that they'll stay at the 1,000? Or they'll stay at the mid, well, I'm just
That's what I'm
saying.
saying.
I'm just posing that question
Yeah.
because by going down the road of not sort of broadly applying benefit, post-retirement benefits to the retiree groups, we are continuing to create silos of different employee
Right.
classes, which I'm just saying, it's going to come
That's
up.
exactly my question. It's going to come up.
It's going to come up, and
Yeah.
the board will be faced with another decision, probably in
Yeah, so I think that's maybe what our discussion really is tonight. Do we just make the decision from here on out that every decision that we make about medical,
Well, but at the same time, this board can choose to say, the program ends. And this group, that's the cutoff date, and we approach a whole different way of looking at post-retirement.
and I think that's what, yeah, there was,
So that, because this day and age, and, I'll give you an example at Tahoe City PUD. 2015 is cutoff date. Employees hired before 2015 have a much, much more generous post-retirement medical package, significantly.
yeah,
Order of magnitude different. But that was a conscious decision to cut costs. And so there are two distinct employee classes in Tahoe City that are so far apart in retirement benefits that it's, but when you sign an employment contract and say, I'm going to work here, you sign the employment contract to get those benefits. And so you understand that I am a different employee, I am a different retiree class than people who signed on before me. But the point is that, we have the ability to understand that this ratcheting, we have the ability to stop it and look at other ways to control post-retirement benefit costs. But if we're going to continue to ratchet this up, and say that it only applies to a certain employee group, we're just kind of keep stratifying the realm of, what people get. And I'm not sure that's good practice.
I'm not either. I thought that's what we
Say that again,
discussed
Tony?
in 2020.
What was your last?
Well,
I think that's where we landed. We're like, this is it. That was our cutoff, and we're not,
so you're under the impression that if the union came back in this most recent upcoming negotiations and asked for an increase in the cap, we would say no. Is that what your impression was?
no. No. So that was a I'm not sure that I tracked completely your bringing it back to how you started that was in negotiations. No, of course, I would be open to.
So I got a question. So the 600 is reflected in both the MOU and the district code. Where did the origination of this 600 come from?
So in 2019, that particular circumstance, the represented group negotiated first. At the end of 2019, there was a tentative agreement that included an increase to the $600, the $600. Subsequent to that, staff met with unrepresented employees, and they selected through their kind of unrepresented negotiations to align with that. And so the board approved both the MOU and the change to Title IV District Code. Approving the MOU applied this increase in post-retirement medical benefits to represented employees. District Code revision applied it to unrepresented employees. So a decision this evening is applicable to unrepresented employees only. Am I correct, Council Gross?
Yes, that's what we're talking about. We're not renegotiating the MOU.
No, I'm just trying to get an understanding of who was the originator of let's increase to $600 a month. And it sounds like it came from the MOU negotiations.
Negotiations with IBEW
Okay,
1245.
but in neither document, it reflects the date that the board had approved in their meeting.
in the MOU, it does reflect that they represent, the negotiations represent represented employees. And so retired employees are no longer represented by that.
But neither, I mean, the list of post-retirement benefits is listed in the MOU,
Yes.
but there's no reflection of the date that you. that
Steve,
the
do you have
board-
something quick or?
Yeah, very
I
quick.
just
And actually,
really quick.
I wanna-
Well, I don't want to, really, I
It's gonna be
really
quick.
want to
It's
finish
gonna
the
be quick.
discussion
No,
on
it's
the
gonna-
board,
add to
but
it.
respectfully,
But what happened
30
was, no,
seconds or
real quick
less.
to Chris's question about this never-ending ratcheting. What happened here was, as a retiree, the board approved district code, $600. Then you had the MOU and you fought over it and whatever, and you denied a grievance. You never came back and changed district code. So me as a retiree, I'm like, what is the plan? In the future, if you decide to do something different and say, okay, you only get this much if you retire by this date, put it in district code. Be clear. Right now, it's not clear to me reading district code. It's not there. But all I'm asking for is clarity. If you do something different in the future, I'm not saying don't. Just tell us. We just want to know the rules. If you want to give us 400 instead of 500 vision, just tell me the rules. But right now, district code says 600 for me. That's what it says. That's what you have approved by resolution. That's all I want to say. But you can do whatever you want in the future. I'm just saying, up to now, you're confusing me because of how it was handled.
Okay.
Thank you.
Thank you.
I think around that time.
I really want to finish our discussion respectfully, please, very much.
That's okay.
I mean, Becky.
10 seconds or sit
Okay,
down?
yeah, okay, thank you. I don't want to be rude, but
In this case,
It's-
the meeting was in May of 2020, and the date was retroactive to January 1st of 2020. So there was no chance for anybody to make a decision, prior to May. And I had to make a decision in the fall. Somebody who retired in January would have assumed they were still under this old way of doing it. So, talking about retroactive, the date that the board picked was retroactive to when the decision was made, so.
all right, thank you. Okay, sorry, yeah, thank you. It's just really distracting, I'm sorry, it's hard I really want to take the input from the board, and I don't want to be rude, but I need to get the thoughts of the other members, thank you. Yeah.
Not sure where I was.
Okay.
Again, that is my only concern, is that every time we renegotiate with represented and unrepresented employees, and we renegotiate post-retirement benefits, every time we go through that process, will there be an expectation that those changes are for all of our retirees?
I think a lot of lessons were learned in this process back when you guys originally approved it. It was the start of COVID, tensions were high, people were retiring, including the general manager was retiring. I don't think he was even at the meeting, is my understanding. I don't know, that's via Zoom. I think that there was just a lot of stuff going on, and with that, the communication in district code and the MOU got dropped off, and that's why I feel that the board has a great opportunity right now to kind of get everybody under the same umbrella and with the same benefits, and then from this point forward, if it's going to be different groups of people, the groups of people that it affected are here 4 years later and really sad. They're like, we gave 26 years and this is happening. And I just think it's an opportunity for us to kind of reboot, restart, and then from this point forward, you can put in the things, but it will be reflected in district code. And even the vision, there's the opportunity to adjust it to add the dates into the district code so it's clear. It's just, it wasn't clear. It was clear in your discussions and at the meeting you guys all had, even though it was half Zoom and it was early on. I wasn't even there, but that's just my take, is I I would like to see whatever has been reflected in district code and the MOU for the past 4 years.
So, Mr. President, you gonna put it on agenda, one of these meetings?
Well, this is it, Mr. Joe.
This is
Do we
the
make
agenda.
a motion here, or what?
Well, I mean,
This wasn't on the agenda, this discussion.
oh,
But-
no, yeah, that's, we're trying to make a decision tonight. That's an action item.
Well, I'm for
Yeah.
giving all the
Yeah.
retirees
Yep.
the same benefit.
So I think Joe and Kim are on the same page. Jeff's weighing both sides, and and I think Chris,
There's no terrible, yeah.
Yeah.
I think Tony is too. Since he researched it and got to the nitty-gritty of the whole thing. I think that the the retirees are retirees of this district in good faith. They did their service, and they're still retirees, period. They're not past May 20th, and they're not before January 1st
right.
of '03, and they're not nothing. They're still a retiree of this district.
So you would like to move, or you would want to go with option B there, to make current and all retired employees eligible for negotiated employee group benefit
Yes.
adjustments.
All the retired employees.
Is that just the vision, or does that include the medical?
The proposed changes for March 6th of this year were for vision. There was no adjustment to the post-retirement medical benefit. And just for clarification, district code, all employees are those not represented by an MOU. And so I'd ask first Council Gross's kind of interpretation of this, but I believe if the board wished to have it applied to MOU represented employees, we'd have to address that in some sort of meet and confer with the union.
Correct. And just to think about, as you're thinking about, you're contemplating action, I encourage you to be extremely clear in whatever action you take, because we've had a lot of conversation tonight about the union negotiations in 2019, what occurred in 2020, the union grievance, the board's action on that grievance, and I don't think there's any intent by anyone on the board to undo or reverse the decision of the board on the grievance. But I think you need to be clear on that, because someone will come back to you and say, I listened to your board meeting on May 1st, 2024, and it sounded like the intent was to undo, reverse the grievance, and now apply all these benefits retroactively. So I think we want to be very clear that if we're not reversing the action on the grievance, if you're just looking to move forward, and not just to think about bringing all retirees up to the same benefits, because as Brian has said, you've got represented and unrepresented employees. And they have different negotiated benefits. And so, again, whatever action, whatever motion you think about, I just encourage you to be very clear as what we're doing, and whether or not this is would be any kind of a one-time action, or whether it's intended to apply to the future. Because as we enter into union negotiations later this year, you'll be hearing from the union saying, hey, we understood that you're going to keep all retirees at the same level, and therefore, as we negotiate, this is our expectation. So again, if whatever you want to do, just be very, very clear.
Out of curiosity, then, is the vision, the $500 vision, that only applies to unrepresented and not to the MOU?
No, the item that was presented to the board also indicated that staff met with IBEW 1245, and they had a vote of the membership, the current membership, to accept that increase as well. So outside of negotiations, they had a meet and confer with their represented group and agreed to that. Recognizing that we have negotiations coming this fall, but the goal was to have this provision increased unilaterally for all current employees. And that was what was understood by the IBEW as well.
Okay, the union is a separate thing from our retirement. Our retirement, we handle it. Up from $400 to $600. The union has nothing to do with that. They got their own retirement thing.
They negotiated on their own terms, but we arrived at the same increase, $600 for both.
Okay, we arrived at the same thing, so it's for everybody. Right? How do you separate the union from our retirement? If we both agree on it.
So we're paying them.
Huh? Now, Steve, what do we have to be real clear on?
Whatever action you want to take. Whatever it is that you're going to vote on, just be very, very clear so that we understand how it applies today, tomorrow.
Well, I'm for B.
Tough decisions.
Yeah.
These are tough decisions.
I think I'm clear on that.
So B, option B, if I'm hearing Steve and Brian correctly, does not apply to the union retirees?
No, they're gonna do what they're gonna do with their,
That is correct.
they're
That is
gonna vote
correct.
on their thing, and we vote on this one.
So
Yeah.
I guess I'm a little confused in something. If an employee retires who's a union employee and they retire, and now they're not represented by the union, where do changes in benefits for them, how is that documented?
So if I understand the question correctly, every employee that retires for the district retires under the terms of their employment at the time of retirement. And so if you're a union employee for some period of time and you end up promoting up into a management position and you're unrepresented, you retire under the District Code Title IV. If you retire under the MOU, those are the provisions of your retirement. And while it hasn't happened in the district in any material fashion, it could, as you pointed out, Tony, that the likelihood of having multiple benefits plans in some year in the future, there might even be multiple MOUs. And so while it's not as complicated at the moment, it could be in the future. And so I agree with Council Gross, just being clear on what the decision is. If the board here has this evening a desire to make it applicable to union represented retirees, I would need the opportunity to re-engage with IBEW or make those provisions kind of codified in the new MOU.
I think that's something we can take off the table for tonight's. I think we can be clear that we're not talking about
I'm in agreement with that.
represented employees. We're not talking about employees that are covered under our MOU with IBEW. Can we take that
Say that
piece of the
again.
puzzle off the table?
So
Again?
let me restate and see if I'm understanding it, so we're on the same page. So tonight, as Council Gross mentioned, we're not reversing the action of the IBEW, and we're not opening up any representative employee retirement benefits at all in this discussion.
Under the current MOU or people that were retired under the MOU? So somebody like Becky. Becky was part of the MOU. She's not anymore. She hasn't been for 4 years. So would our action, is she now considered district code?
Yeah.
Yeah, that was my question, is they're no longer represented by the union, so how do what codifies benefit changes for retired union employees? That's my
Okay, so this
question.
is in fact every single.
That's my question.
The code applies to all retirees,
Thank you.
right? Because they're not part of the union anymore, but the union does negotiate a benefit through the MOU. But we're not modifying the MOU, but the code does apply to all retirees.
Yes.
Right. So
Thank you.
if we make a decision tonight on modifying district code to, in some way, shape, or fashion, without being deliberate, saying it only impacts these employees from a certain date, if we feel we're going to make it available to all retirees, then we are talking about all retirees, not just unrepresented.
Got it.
Got it.
So that was, in my mind, I've always been saying, if we want to discuss I'll call it a cost of living adjustment to existing retiree benefit plans for employees who retire prior to 2020, we are talking about all retired employees. Because all retired employees are part of that group.
And Brian, you said that was 48 individuals.
As of January 1st this year, yes.
Okay,
Plus
Plus their dependents.
their dependents, any qualifying dependent.
okay,
To the $600 limit. Yeah.
yeah.
Because I see that there's a percentage list of what they get of the years that they worked in this thing here. So it's gonna be, they pay part of a little bit of the retirement, right? Because of the schedule here. Now, 20-year, they got 100% pay from the PUD.
No, 100% of the cap that's
Of the cap,
contributed.
yeah.
So, say that their insurance premium was $2,000 a month, and they've worked 20 years and they get 100% of the cap, they would get $600 from the district towards that $2,000. So out of their pocket to pay for premium would be $1,400.
Okay.
And if they worked only 10 years, it would be down to $300. So
The employer
they're out of
still
pocket.
pays something though.
Oh, they're paying the majority of their premium.
Yeah, we're just raising them to $600.
The cap that the district is contributing,
It's gonna be
which,
more money out of the budget, but that's the way it goes.
Right, 0.66%, Joe.
We find money, pardon?
Point about if we do, or if we're doing 13 million a year, in electrical
Yeah,
rates,
Right.
then it's 0.6, 0.7%
okay.
of that.
So, question for Steve Gross. Based on what? If the board moved forward with saying that we want to apply the increased package, which includes medical, to, the packaging, which includes medical, yeah, to the group that was excluded in 2020, of course, we're not going backwards. It would be, in my theory here, we would be starting at a certain point in time. Does item B cover that clearly?
Yeah.
Or do we have to change, or would we have to make a different?
I'd suggest a different motion, okay? That if you want to change retiree medical and vision benefits, the cap on those, effective as a certain date, whether it's today, June 1, whatever, January 1, that you make it clear that cap applies to all retirees as of that date, be clear as to what the cap is, and that we adjust the code specifically to make it clear when that benefit begins. We not just leave the code as it is, because then the argument will be that it applies retroactively.
Understood.
So I'm taking, Jeff, that you feel like this, the percentage is small of our overall budget. You've made that point
Right.
a couple of times. My concern is just moving forward, that every time we address this, that it will include, that the costs will just continue to
Right.
move beyond that small percentage, especially as, I don't know, we don't know what the future holds, put it that way. Right? When we set a precedent that says, that's always, which I don't believe that we have done before. Like, that was what the May 20th, 2020 meeting sort of was about. Like, we don't make these decisions and then we increase the cap, we renegotiate something, we increase the cap, and that in the past did not extend to all retirees.
Yeah, we were creating another
That's
retiree classification,
right.
essentially.
So, and that's what I thought in that meeting in May 20th, 2020, that was our decision, was that every time we make one of these changes, it's just moving forward. It's to current and future retirees. And the next time we do it, it'll be for current, or not for current, but people who retire on that date or forward. So that's, again, I stand by that, but I understand what Director Harris is saying, what Kim is saying, that this was, it seems like a small thing at this moment in time for this group of people. It's big for them, but small for us. So I just want to be clear that we don't have to keep having this meeting and this difficult discussion every 3 or 4 years. What is, how do we
Avoid that.
avoid that?
Yeah.
How do we, people in the future are going to say, well, you guys did it for them. I also gave 25 years, and then you made, another decision, and you said.
It just wasn't reflected in district code.
So.
And for your history, and Steve provided this, it was in 2003 was the last time that they increased it.
Yeah, and I think there is a strong argument to be made for cost of living adjustments. I mean, we did see what inflation did to people, for the past 3 years. So I get those things. Again, I want to, how do we stop this cycle?
Well, I
Or
think
do
that's
we?
a much bigger question.
Oh. I didn't mean that.
Well, no, it really is, because, we have to, that's a whole different topic, and it is ripe because we are going to negotiations, and we need to, we need to also just talk about big questions about how do we begin to reduce our unfunded liability? How do we, do that? So, I feel like, it is a bit counter to what we're talking about now, but I feel like, as I said, I brought back the theory or the idea of, do we want to entertain a cost of living adjustment for the group of retirees that retired prior to 2020? And that's really what this boils
Kinda
down
is,
to.
yeah.
Because we can do whatever we want in the future. And I'm not talking about the future, I'm talking about that
Just
specific group of people. So, that's,
Clear as
so,
mud.
yeah,
Clear as mud.
I don't know. I kind of simplified it, Steve, by saying that, talking about cost of living adjustment for that group of retirees prior to 2020, but is that fairly accurate?
I'm not sure I understand your question.
Well, I guess, I'm couching it as not a change to district code, not a change to, what I'm saying, that my approach to this is, we're just simply approving a cost of living adjustment for that group of employees who retired prior to January 1st, 2020. And bringing them up to this level,
And then from there on out,
From there on out, we can do whatever we want.
Yeah.
Well, it's going to apply to, if you change this, it's not just going to apply to retirees that retired back before May of 2020. It's going to apply to all retirees going forward
that's,
Yes.
until you change the code, right? So if you increase the cap for retirees, just call it up from 475 to 600 for 20-year plus service, that's going to apply to every retiree that exists today and tomorrow.
It's already in district.
We're not, I don't think they're adjusting the cost of it.
We're bringing.
They're bringing in the people that were identified as a separate group. That separate group that retired prior to 2020 is going to be brought up to what is listed in district code.
We also need to include retirees between 2020 and 2024, because this,
Already there.
Already at 600.
you're making the, so, board, I just want to make sure it's clear, the board's making a recommendation effective January 1st, retro of this year. All retirees moving forward would be in district code with however we want to make the board recommended changes. And then the cost of living adjustment is applicable to anybody who retired prior to January 1st this year.
Not to this level.
What's that?
Well, so, yeah, I mean, I guess there's a group of people who retired between 20 and 2024 who did not get the vision because they got the medical, right?
Correct. I'm just saying, we just made changes for this year. We want to make those retro for the small group that was in that gap also.
I see. But that only applies to vision,
Yes.
not to medical.
Yep.
Okay. Which is not a, it's a pretty small number.
I do not have a clear
I don't either.
written motion.
I'm wondering if we should do the vision one as presented here, but then the medical have like special direction to staff that any retiree who is under the previous caps, monthly caps, are brought up to what the monthly caps are listed in the district code. Is that
The-
clear
the
enough?
current- So the issue is the current code doesn't reflect the board's last action in 2020. So that $600 benefit doesn't apply. Applies to the unions, but not to the current retirees. Okay?
Yeah, public comment is
The code wasn't
closed.
changed, but the
Public
board
comment is
took
closed.
action, okay?
You
We've
know,
been through
can we-
that a dozen times.
I
Yes,
gotta
you're
pee.
arguing.
5-minute recess. I gotta pee.
Yeah.
And I can't think. All right. So, just to be blunt.
Now, we're on 12 or are we on
Still on
17?
16.
Because when we did 16, you
Neither,
said we
we're
were
on
going to go
16.
from
Still
there.
haven't done
We're on
anything,
16. We're still on 16?
Oh, we are?
Yes. And
Where my 16 is, so let's,
Steve, I rudely interrupted you for a short recess, and if you could clarify.
So, thanks.
Your comments.
So I need to go back to a question that Tony asked earlier. Okay, what happens with a represented employee's retirement? When is that locked in? Is that part of the code? Is that identified in the code, set in the code? And I said it was, and that was wrong. It's locked in with the MOU that's in effect when a represented employee retires. Okay, so it's so the MOU, in the MOU, there's a retiree medical cap, vision cap, and when an employee retires that's represented by the union, they're locked in at those caps that were set forth in the MOU in effect at the retirement. The code is going to apply to all the unrepresented employees. So for tonight, so Ms. Mazur retired as a member of the union, locked in at what the benefits were in the MOU at the time. Wouldn't be affected by this discussion or by this action. Mr. Hollibaugh, unrepresented, could potentially be affected by this. So I need to clarify that for you, okay? So that we do have, as Brian had correctly said, two different classes of retirees. Benefits may be aligned at the moment, but they're negotiated, the represented benefits are negotiated through the union, set forth in the MOU. Benefits for the unrepresented are in the code, and that's what we're talking about tonight. We're not talking about the MOU, we're not talking about renegotiating the MOU or any benefits for employees that are represented by the union.
Okay, good. That's what when I first said that, that's what I thought.
And now we've clarified,
Yes, that-
confirmed.
And we're not talking about
Okay,
revisiting that contract.
correct.
The MOU with IB, we are not talking about that. Those retirees are those retirees.
Okay. All right, and then Tony, you were discussing somewhat of a COLA, something to the effect of a cost of living.
My intent was to discuss, I'm just calling it a COLA, but all I'm trying to really do is say, is the board want to entertain the idea of bringing all retirees up to the current level of the benefits in the MOU and district code?
Wait,
That's,
time out, you just said MOU and.
well, apparently now they're two separate things, so.
Right, oh, okay,
And
okay.
we can't change that. I mean, this is the thing. We
Yeah.
don't want to
Right.
revisit that MOU. We can't, we're not gonna dabble our fingers in that tonight. That would be
Right.
bad. So whatever decision we make apparently doesn't affect folks who retired, who were represented when they retired.
And so, yeah, so the intent for me was to bring back the idea that we would bring all employees up to the current limit caps that are in, and as I said, that are in the MOU and in the district code. That was my intent, to have
Okay.
that discussion. So I'm not interested in talking about only applying this benefit to
Unrepresented.
unrepresented.
Okay.
Okay, and I believe Kim and Joe, you all were both,
pardon? What was that last word or two?
Kim and Joe,
Yeah.
and then I'm not there yet.
That's all he said.
So that's all I've said so far.
Oh,
So,
okay.
yeah.
I thought they were
So-
saying a couple more questions.
So I think Kim and you, Joe, are on that same intent of Tony's, correct or not correct?
Yes, correct.
Yeah.
Okay.
All the
Bringing the group of employees that are retired, that we have kind of the control over, to bring them up to what is currently listed in district code.
Yeah.
Okay. All right, now I'm going to look at B-dub.
How you gonna look at?
That, we,
That excludes
That
everyone
excludes.
who is in the MOU, whoever is a member of the union and retired prior to 2020. From my understanding now, is that they receive the benefit that is listed in the MOU at the date of their retirement.
And Brian, you nodded correct.
That doesn't do much for the audio, sorry.
Right.
Yes, that is correct. And unless it is acknowledged and accepted at the time of negotiations by both parties that a certain provision would apply to previous MOU represented employees. That's what was at the crux of the grievance back in 2020, was that those negotiations didn't apply. They were not applicable to previously represented MOU or union employees, but for current union employees. The provision for vision and the adjustments to PEPRA and the adjustments you saw on March 6th this year were approved and executed with a side letter of agreement with IBEW, with the understanding that those applied forward for employees, current employees and future retirees. Doesn't mean we can't do something different, but I would need to go to IBEW and have that discussion.
And that is what would be required to handle what what he just stated his intent was for those IBEW MOU employees.
retirees, all retirees.
Well, right, it seems like it's one step we can take care of unreps with board action tonight. But for Becky, for example, that couldn't happen tonight because that has to go into negotiations.
I would need to have discussion with IBEW, and I would need the board's guidance on what, at a future date, have some guidance on what the board's direction is in terms of the terms. Are they the same as what we're approving this evening? And have that discussion with IBEW on an updated or revision to the letter of agreement, making sure that we understand that this isn't a revision of the board's determination on the grievance back in 2020, but a new addition or adjustment to the clarifying language of that side letter of agreement.
Can you say that one more time?
I was like, okay, I was thinking in my head, okay, you had me on everything except the very end.
As Council Gross mentioned earlier, it is important that the board is very clear on what direction they're giving to staff. And if you would like this adjustment to be applicable to retirees under the MOU, I hear that as a potential action from the board. I would need to go to IBEW to clarify that side letter with a revised side letter.
That's fair. So, but tonight we can address the employees, the non-MOU employees, so the unrepresented employees. We can, or retirees that were prior to 2020.
Title IV, a revision to Title IV or direction to staff to approve a revision to Title IV would be applicable based on the language that you present to unrepresented employees.
Well, wouldn't there be, like, just with what you were saying, Tony, excuse me, with board action, couldn't we just wrap it all up and then you deal with the nuances? I don't know, I'm just thinking out of the box, you know?
I would bring an item back to the board on June 5th to confirm, approve a side letter, a revised or updated side letter agreement.
Are you nodding, Tony, or?
Well, no, I'm saying, I mean, that's a possibility. I mean,
Yeah, yeah.
That's, the board can say that we can take two separate actions. We can take no action, which is, we don't do that. We can take two separate actions, one tonight, one next month, or we can, you know, table the item, let Brian and Steve, you know, get the union's feedback on this, and then bring back a comprehensive package to us on June 5th that states we do nothing, or we do this for all employees. And we take one action. It's not delaying anything, because I think at some point we're going to be talking about a date that it's going to be
Still gonna- yeah.
effective as of, you know, whether it's today or January 1st. But I'm just saying, if we want to simplify this process, so we come back and we have one, you know, not that I want to go through this whole thing again.
Yeah.
But we're going to have to go through it again either way. So the question is, do we want to do it, have a comprehensive package brought back with a set of parameters, which is A, either we do nothing, or B, we do
This thing.
what we're proposing for all employees, so, and it involves unrepresented this, and then represented or under a side letter, you know, agreement, and then we take action on that in June.
And I would want clarity on, this is a one-time reset. This is not something that we would, we're not setting a precedent that moving forward, every time we renegotiate.
Absolutely not.
So, right. I would like that to be clear too, because I don't feel like that was clear in 2020. Hence, here we are.
Well, this situation kind of puts everything on an even keel right now.
Well, I mean, all it means is every time we do something, like, every time something comes up that, you know, that we are creating, you know, silos, that it has to be specified in district code. This group is, this group gets this group gets that, and so, yes, I agree that, obviously, that we want to be clear, and I think that's to Steve's point, we need to be clear. Well, we need to be clear, and we can be clear in the district code how things look backwards and how things look forwards.
You know, if you'll.
So, you know, not having any kind of discussion, I mean, assuming, you know, that it is clear that the MOU employees who retired under the MOU are still under the MOU and not under district code, then, you know, we have another step.
Right.
So based on the discussion I hear, I think I would recommend, as representing staff recommends that we have the opportunity to bring back a cleaned up recommendation. I think from, you know, with board guidance, that we come back with a recommendation to bring all of the retirees up to the $600 or the current cap and vision benefit. I'll have a discussion and meet and confer with IBEW to make sure that we have an equivalent version of that in a side letter of agreement, and bring that to the board for approval of both those items.
What date are we looking that these to be effective? Starting July 1st, starting June 1st?
Oh, I mean, I was under the assumption of Jan 1.
January 1st, 2024? Okay.
That does what?
Wrong
I
in
think,
that, or are
no,
you good
no,
with that? Oh,
believe
okay.
me, I know it's a little extra work for staff, but
Oh.
I think they'll be, I think they will welcome having it consistent for now, but with any future board actions, that it's just outlined clearly in district code.
January 1st, we might have a new board. Or part of a new board. That's another thing you gotta think about.
But this would be backdated to January 1st, 2024, so the beginning of this year.
Correct.
So hopefully this board will be able to
Well, I think,
get her finished.
yeah, when's our next
I know
board
staff
meeting, Brian?
wants it.
Now, what is this January 1st going to do? Is going to be the start of what? B?
Start of B, yeah, it would be the January 1st, 2024, so of the beginning of this year. And what they're looking to do,
Okay.
and they're going to come back to us, because we have an MOU, they would also need to talk to them about a side letter about bringing all retirees that are unrepresented, that we could approve tonight, but we're going to wait and do it in one fell swoop, but bring everybody up to the $600
Yeah.
level starting January 1st.
And that's the top end of the scale, right? Because that's for the 20-year.
Whatever is currently published in district code.
Okay.
Those are the levels. So it's $600, except if you have spouse independence, it's $1,000. And if it's Medicare, I want to say it's $500.
Okay. All right, just asking for clarity.
The vision and dental, that's all been approved by IBEW in a side letter, right? So as of
Correct.
now, district code and the MOU are equal.
Correct.
Okay.
Okay,
And that's
now,
as of January 1st, 2024, correct?
Correct.
the union retirement, the MOU, is, how many people are in that retirement?
We don't know. It's 48
Altogether.
individual employees and then plus up to
Okay, are they
88.
just getting the MOU retirement, or are they getting our retirement too?
It's all going to be the same.
Up until this point, they've been equal.
Yeah.
Until the most
That's what I
recent-
just said a
yeah.
little while to myself, I guess. 'cause
Just by
nobody heard me.
chance.
That
Just be-
everything's going to level out right at this point.
Yeah, next month we'll approve, we're going to look at approving leveling out the
Yeah,
rest.
all retirees. Yeah.
Correct.
Okay,
You like that, Joe?
I like that.
Okay.
Thank you, guys,
Everybody's equal
for your
then.
patience.
So I don't think we need an action or a vote. Staff has guidance, and we'll come back on June 5th with a cleaned up action and appropriate background information.
For June 5th.
June 5th,
We don't
first
have
Wednesday
another
of the
meeting in
month.
between then, huh?
I won't be here June 5th.
It's May 1st.
Forewarning.
So
Okay.
Don't we
I
have
think
the
we
Have it
had
all
meeting?
squared away.
We don't have another meeting?
It's going to be
in between?
clean though, coming in. So, yeah, good
Clear.
discussion tonight.
Typed up
Okay,
into
that
the
was
code.
16?
That was 16.
I finally found it.
That was it.
All right, moves over.
Okay, can we consent the rest of the calendar? No. Sorry, Neil. Okay, all right, we're finished with 16, we're punting on June 5th. Staff has clear direction on that for the next meeting. Thank you, everyone, for attending
God.
public comment. And, okay, that takes us to action item
See you, Jim.
13. Thank you. Good night.
Steve?
Good night.
15.
No, 13. Consideration of approval of a contract with Resource Development Company for the district
I got
ski
it.
run tank replacement project for amount not to exceed 1.317600.
We're through with 16.
Yes,
13 now.
we're now going, we're mixing it up a lot tonight.
Oh, my God, just holler out what it is.
Yeah.
Let me see what I have for 13.
Neil Kaufman's got the mic.
Good evening, President Benner, members of the board. This is action item number 13, award of the ski run tank replacement construction contract. I've got some background in here that we've discussed a couple of times in the past. I will try to move through it relatively quickly, given the length of the meeting so far.
Thank you.
So the district currently operates 34 water storage tanks.
okay.
They're outlined here. The great majority are ground level welded steel tanks. These range in volumes from 100,000 to 1.5 million gallons.
Page 55.
Our oldest tank was constructed in 1963.
the newest one in 2021. And we do currently have the Bridge Street 6170 tank number 2 under construction. They completed all of the welding work and fabrication on that, and the contractor should be returning shortly to go through the painting and coating of that tank. And we hope to have it online within a couple of months. So the 2020 water system CIP identified the need for additional storage tank maintenance funds. Many of those tanks still have their original interior coating systems, and the design standards and seismic engineering requirements have changed significantly over the years. We hired an outside consultant to conduct an evaluation of these tanks. And through that, we developed bid documents for rehabilitation of the Round Hill tank. Bid documents for the Round Hill tank were prepared. Bid opening was held in April of 2022. Contract awarded to Resource Development. As we got into that project, the metal degradation was worse than anticipated, and we required some significant additional repairs that were not included in the original bid. In September of that year, the board approved an additional contract with Carollo to evaluate the Ski Run tank and Prosser Lakeview tank and prepare contract documents for rehabilitation of both of those. Prosser Lakeview tank was drained to perform some field inspections. We found significant deterioration of that tank. We did some further evaluation, determined that we can operate the water system without the Prosser Lakeview tank, and we are recommending that it not be rehabilitated, and we are planning to abandon that facility within the next 5 to 7 years. The Ski Run tank was constructed at the same time as Round Hill by the same contractor. We expect conditions similar to Round Hill will be encountered. However, we could not drain the tank to perform a thorough field inspection due to the way the water system is configured and operated. And both of those, there's a pump station at that site, and it's critical to moving water to the upper elevations in Tahoe Donner. And so we can't abandon that site. We do need to operate that going forward into the future. In February of 2023, Carollo completed bid documents for rehabilitation of that tank. We had a bid opening in March. Our low bid was just under $400,000, and we assumed that the overall project cost would be around $600,000. Given that cost, we recommended that we not proceed with the rehabilitation. That tank is undersized. It's one of our smallest at 100,000 gallons. The rehabilitated tank would not meet seismic codes, and it is susceptible to damage in an earthquake event because of its dimension ratio. And it also would not meet current standards regarding vents, sample ports, ladder systems, and some other accessories. So in April of 2023, the board rejected the bids for the rehabilitation of Ski Run, and we started moving forward with a replacement of that tank instead. So an RFP was issued to select a consultant. 4 proposals were received. Design contract was awarded to Sowers Engineering in August of last year. The bid documents were completed in March of this year. Scope of work for the project is we have a new 214,000 gallon tank. This will be adjacent to the existing tank. So we have some grading and site piping improvements. We're going to leave the existing tank in service to provide customers while the new tank is constructed. We're going to have demolition of the existing tank after the new one is completed. And as we noted, there is a pump station at the Ski Run site. That is also 50 years old plus. That will need to be replaced within the not too distant future. and we're expecting the pump station to be located where the existing tank is right now. So once the existing tank goes away, that will give us a nice platform to build the new pump station. So the bid opening was held on April 17th. We received 3 bids. They're outlined here. Our low bidder is Resource Development Company, just about $1.2 million. As is typical on most of our projects, we're going to have some related contracts. We've got some construction inspection by CME, some minor environmental services, and we also have geotechnical testing. Project schedule is outlined here. Assuming the board approves the contract this evening, we're hoping that the contractor can get moving by the end of the month, and we are anticipating a completion of construction this calendar year. So in terms of fiscal impact, again, the bid price from Resource Development, just under $1.2 million at $1,197,800. We are recommending a 10% change order allowance, so that would be a total authorization of $1,317,600. Now, the rehabilitation of the ski run tank was included in the Water Department's 10-year capital improvement program. However, as we noted, due to the change orders we had with rehabilitation of the Round Hill tank, we decided to move forward with replacement instead of a rehabilitation project. So the replacement cost is higher than the anticipated rehabilitation cost. The Water Department does have sufficient funds to cover the cost of this project. However, some other rehabilitation projects may get pushed back a year or two to keep the overall expenditures for tank maintenance within our targets. So the recommendation before you is to award the ski run tank replacement construction contract to Resource Development Company in the amount of $1,197,800 plus a 10% change order allowance of $119,800 for a total authorization not to exceed $1,317,600.
Great. Thank you, Neil. Any public comment on this item?
Got real quiet in here.
Yep, no public comment. We'll close public comment. Any questions or motions from the board?
You say this tanks, there's 2 tanks there now, and you'll close one, demolish one, and keep the other one going to keep the water flow.
There's only a single tank there right now. So the way the project is structured is that we're going to build the new tank adjacent to the existing one.
Okay.
We'll leave the existing one in service while the construction takes place. And then once we're done building the new one, the old one will be torn down.
Good, thank you, Leo.
I'll move staff's recommendation.
Oh, beautiful.
I'll second that, Rick. I'll second that moving.
Is there a roll call vote? Please.
Let's build a tank.
Director Guerra,
Yes.
Director Harris, Director Laliotis.
Yes.
Vice President Finn,
Yes.
President Bender.
Yes,
Thank you.
thank you. All right, you got a tank, Neil.
I'll have one in about 6 months.
Perfect. Not there yet. All right, number 14, consider approval of 2024 Quarter 1 power cost adjustment. Mike, I'm not going to read the rest. Number 14.
And
Good
that's
evening,
to,
President Bender, members of the board. This is action item number 14, Power Cost Adjustment 2024 Q1. So with the adoption of electric rates in November 1st of 2023 for 24 and 25, we had a new item in there called
power cost adjustment, and that's what we're going to talk about tonight. First, a little context. This is a few background slides. Purchase power is about $15 million in our annual budget for 2024. It's almost half of our operating expenses and a third of our uses of funds for the year. And then our sources to pay for that cost is primarily rate revenues, so our rates for our customers. The budget for 2024 is based on 174,000 megawatt hours purchased at an average cost of $85.77. And there's a lot of variabilities there, and I'll get into that here in a second, to the components of that cost. This is a chart from the budget presentations in the fall, showing the mix of our purchase power of almost 15 million and its various cost components. So what is a power cost adjustment? This is a new line item on our electric bills that can be either a charge or a credit, and depending on how our wholesale cost of power goes. And this adds an element of cost variability and transparency to our bills for our customers. And we're utilizing a quarterly true-up between the budget and actual costs of this key budget item. Any material fluxes beyond 15%, we would be addressing with our rate reserves, potentially. So the power cost adjustment is a way of managing the fluctuations up and down in our power cost. And it's a method to pass the variability onto our customers on a quarterly basis instead of through like a biannual budget process when we go to set rates. Because ultimately, everything is flowing through plus and minus to our customers. And so it's just a matter of the timing. And through this power cost adjustment, we're kind of doing more of a real-time, albeit quarterly, adjustment of this particular line item in our budget, true up, if you will, with our customers. The PCA, as I mentioned, is new for us for 2024, and many other utilities have this throughout the nation, probably the world. And other times they have different names for it. We're calling it a power cost adjustment, but essentially the same thing, and we're doing it quarterly. So the cycle, as in the ordinance, is it was established that we have a PCA at 0 for the first quarter of actual billings because we don't know what our variance is to budget yet. And now that the quarter's done, we assess that and we'll affect it on our May, June, and July bills. So when we analyze the first quarter, we actually bought more megawatt hours than we anticipated, and that's due to the variability of many things. And driving on the volume side for our megawatt hours purchased. And this is a chart showing, we did a statistical regression, Stephen Keats and I, looking at 14 years of data and weather data, temperature. And we're able to isolate the amount of our kWh that is driven, estimate the amount of kWh driven by base load, if you will, base uses, and then how the temperature fluctuates. And that's about, for the heating element, it's about 22%. And so when you assess that on a quarterly basis, you'll see, and this is kind of obvious, but we did it mathematically, that the first quarter is highly influenced by heating degree days, much more so than Q2, Q3, and then Q4 is also highly influenced by heating degree days, so the temperatures that are involved. I'll go over this more when we have more time.
Thank you.
I'm going fast on it. Bottom line is we did purchase more kWh than was budgeted, and I'm isolating that separate from the cost of the purchase power, which was budgeted for the first quarter at $85 per megawatt, and it came in at $78 per megawatt. It's less. That's good. That means a credit to our customers. So I have good news tonight. Okay? Why is it less than budget? Oh, I should point out, it is substantially, the $78 is substantially less than last year, same quarter as well. It was almost $95. But why is it less than budget? It's a thing called natural gas. Well, we're talking about electricity. Natural gas is used to produce electricity. Not all of our electricity, but it is one of our components, and we had low prices. This is a chart last 6 months of natural gas prices. Okay? So from October, about when we set budget, until now, on the far right. And if you look at it over 5 years, you'll see that we're kind of at 5-year lows right now in natural gas. So natural gas prices are very favorable in the market in the U.S. currently. Tomorrow could be a different story. These are the prices of a few of our select UAMP sources of power and their costs for Q1, both last year and then for budget and then actual for this quarter. The unspecified component of pool was $115 last year, $103 this year, and $51 per megawatt.
Wow.
And that 51, I believe, is somewhat dominated by natural gas sources of electricity production. We don't know that for sure. It's pool and it's unspecified, but Nebo is definitely a gas plant for us, natural gas plant, excuse me, and that came in under budget. Horse Butte is wind, obviously, or as indicated, it's wind, and that was it's very close to budget. It's a high producing quarter for that energy source. Solar Red Mesa was spot on with budget as well. And then landfill natural gas came in a little bit under our budget.
Correct me if I'm wrong, though, the Q1 2023, we were in the middle of that insanity, right? That 115 was part of.
It includes January. Thank you. January was off the hook,
Right.
In a bad way, in a very bad way.
That's a point in time. It's not 100% representative of a broader average.
Yes, sir.
So
It did normalize after January. Yep. Thank you for bringing that up. Yep. So what does it all mean for our customers today? The budget was $85, almost $85 per megawatt. The actual was $78.45. That's $6.28 variance in cost per megawatt times our megawatt hours purchase generates a $325,551 credit. How do we apply that to our customers? We look at how much kWh over the next quarter they're going to be billed for. And that's based on budget, and it's part of why I showed that previous chart where Q2 is much less volatile in our kWh billings than Q1. Q1's a little harder to predict than Q2. So we divide the billings for May, June, and July into that dollar amount, and we get a 0.0088 per kWh PCA credit for the next 3 months billings in May, June, and July.
So will that show up on their bill as a credit? Or is it just different cost?
It will show up on their bill as a credit. It'll be a line item, a separate line item, and then we'll have a message calling it out a little bit in the message box. And then it will also have a URL to direct them to the website for additional information about the PCA. But it will be very clear that's unless you're not good at reading anything, that it's a credit and it's reducing your bill. And that credit is about 4%, taking that 12% rate increase to about 8% for Q1. And then looking prospectively, that's about just over $7 per customer, per account average credit per month for the next 3 months. Then we'll do this whole thing again for the next Q. And we'll also true up for my estimate on how much we billed, because I need to credit back to our customers that $325,000. And if we bill more or less, I'm not going to get that exact amount, and so that small amount of true up will be factored as well, either way, either direction to accommodate for that. But
you're not readjusting the budget, right?
No, sir.
Not readjusting the projected cost that you plugged into the budget.
I am not. Correct. Yep. So if the markets continue the way they are, We should be in line with a similar credit, maybe a little less for the next quarter. I can't promise that for sure. We're just now in Q2, so we've got a few ways to go in those 90 days. Yeah. And our biggest cost per megawatt is actually Q3. And there's a couple of factors. Look at that a little closer. I think in part due to we have fixed costs in some of our billings. For example, NEBO, we're part of that project. And so there's debt service. And so even though we may procure less KWH, there's a fixed amount of cost in the NEBO plant. Same with some of our other projects. So let's see. No real fixed fiscal impact. It does mean that we don't keep that $325,000 for in case we went the other direction. We will have given it back to the customers, but then if it goes the other direction, we will have a PCA charge on the bills in future months. We knew going into this that it would add some volatility to our power bills, but we're still only on one page, unlike Southwest Gas and PG&E that are at a minimum 4 pages of detail of line items on their bills for things like PCAs and other charges and things like that. So we are getting a little more sophisticated and complicated on our bills, but
Still one page.
we're still on one page. That's right.
And we only have a 3-letter acronym where they have a 4-letter acronym.
Yes. So the recommendation was, per the staff report, was to approve power cost adjustment for 2024 Q1 of 0.0088 credit per KWH billed in May, June, and July of 2024. With that, I'll turn it back over to President Bender.
Beautiful. Thank you. Any public comment on the PCA tonight? No one, everyone wants it? All right, public comment closed.
It's just
Chris-
nice to see
yeah.
this as the first example of the PCA, so
Yeah,
yay.
pretty awesome.
Yes, nice to see it in action, and at this point, as a positive for
It's a
employees, for
Yeah.
customers, so.
So they'll get a credit on their bill this month.
Yep, and next month and next
Take the
month.
Take the win while we can.
Right.
All good.
I'll move staff's recommendation.
I'll second.
Oh, we have a motion and a second. Roll call, please.
Director Goria?
Yes.
Director Harris?
Yes.
Director Laliotis?
Yes.
Vice President Ben?
Yes.
President Bender?
Yes.
Thank you.
Great, thank you very much. Okay. Now we're on to 15, consideration of a construction contract for the East Office remodel.
In the what office?
East Office,
This office.
That office.
over there.
Oh, over there, okay. Well, that's Brian's office.
The east-
Huh? Brian's office.
BW, not BY, right?
Good evening, President Bender, members of the board. Tonight, we're here to talk about action item number 15, award of the district administration building East Office remodel, 2024 construction contract. There's some background and some related project history here. I'll try and be expeditious to get through here considering the time. The East Office and Boardroom remodel project are viewed as the final phases of the district's lobby and office remodel projects that began in 2018. The lobby and office remodel projects were initiated to create a more welcoming and useful lobby space, to update administrative, operations, and engineering offices and meeting room spaces, and as well as to bring publicly accessible spaces such as restrooms and customer service counters up to code requirements. The East Office remodel project is initiated to relocate key workspaces from the upper floor to the lower floors and vice versa, essentially relocating the general manager and the clerk's department to the lower floor to enhance accessibility and engagement of the organization and the community, and to facilitate an environment of open and transparent communication, as well as support across all operations. Associated, there is, staff identified the need to complete some minor remodel work within the boardroom, this room. The concepts were to address the layout of staff and attendees of public board meetings, to improve the lighting within the space, to improve the general utility of the multi-use meeting space, to make it a little more flexible, and to accommodate the emerging need for hybrid meeting accessibility, given virtual meetings and in-person meetings coincide these days. A little bit more of the history. At the June 7th, 2023 Board of Director meeting, staff provided the board a project update for the East Office remodel. At the time, there was an action item. The board approved the extension of the contract with Fringe Studios, or now Bennett Binns Architects, and that was toward the design completion and bidding coordination. There was no fiscal impact at that action item. Bennett Binns Architects completed contracted design services for the East Office remodel to date, and we're about 50% complete with the boardroom remodel design. Staff has currently put that design effort on pause. This image depicts the floor plan, kind of the impact, the construction areas. Clearly, it's here at the district headquarters. All the construction is on the first floor, and the construction areas include the general manager's current office, the Tonini conference room, some adjustments, adding walls in the lobby area, and the public information officer's office with a fire egress is adjusted. The facility, facility master plan update project may have an impact on the remodel project priorities. JK Architecture and Engineering was contracted for facility master plan generation in 2019. Facility master plan offers a comprehensive analysis of the Truckee-Donner PUD properties, operations, and facilities to provide a facility master plan in 2020. The draft 2020 facility master plan was developed, and the project was paused before reaching completion and approval for adoption by the board due to changes in personnel at the time, as well as shifts in operational philosophies in the last 4 years. At the February 7th, 2024 Board of Directors meeting, staff presented an informational workshop to provide an update for the Facility Master Plan project, including history and current status. The board at that meeting expressed interest to continue to work with JK Architecture and Engineering to continue to update the draft 2020 Facility Master Plan to include 2024 building code and development requirements, consider current and future regulatory constraints with consideration to alternative opportunities and possibly properties for potential relocation. At the April 3rd, 2024 Board of Directors meeting, the board authorized the general manager to execute a new contract with JK Architecture and Engineering to update the draft 2020 Facility Master Plan. The intent would be, the opportunity would be building upon existing facility assessments that were completed as part of the 2020 project, thus not generating all new information from scratch, but more updating the information that had already been collected. And then as well as expanding the scope to incorporate what we missed potentially in the last 4 years, the 2024 building code and development requirements, considerations to current and future regulatory constraints, EV charging, hydrogen fueling, infrastructure, photovoltaic opportunities. Those are just some examples. On March 8th, 2024, a request for bids was published for the District Administrative East Office remodel project. It was publicly advertised in the Sierra Sun and the Truckee Donner PUD website. Bid opening was held on April 15th. 6 bids were received, and all bids were considered responsive. The bid submitted by GLA Morris Construction Incorporated from Truckee was determined to be the lowest responsive bid received at $373,265.20. Staff have evaluated the bids received and recognized the estimated total project cost are higher than anticipated. The district does have an immediate need to develop additional staffing workspace, and the proposed remodel would accommodate these needs, although a more temporary office enhancement may be a more cost-effective approach. Another related project, originally the district had pursued interest in a building modernization project, which included the remodel of the building frontage, impacting 3 sides of this building, including the incorporation of energy efficient windows and solar awnings, and with a redesigned covered main entryway and new improved signage. The facility modernization project encountered some challenges with the permitting process, and we discovered that the district's current office building is in legal nonconformity with certain building codes and would be required a resolution as part of any exterior remodel. We would have to update to bring the building back into conformity, essentially. Recognizing that these remedies to the building code issues would negatively impact the feasibility of the project, efforts were redirected at that time for completion of the facility master plan. With all of that history and background, staff is presenting 2 available options for Board of Director consideration related to the construction contract for the East Office remodel. Option A, approve the contract budget and staff to proceed with contract execution for the East Office remodel in parallel with the 2024 Facility Master Plan update. And option B would be to disapprove of the East Office remodel project, reject all bids received to permit the board the opportunity to consider new information resulting from the completion of the 2024 Facility Master Plan update. The fiscal impacts, each option has a fiscal impact. Option A has a fiscal impact of the lowest responsive bid received, GLA Morris Construction, Inc., with the lowest bid amount of $373,265.20, plus a change order authorization or allowance of 10%, or $37,326.52, for a total project or construction contract budget of $410,591.72. Option B, there would be no additional fiscal impact related to this item, as the budget for the 2024 Facility Master Plan update was approved at the Board of Directors meeting on April 3rd of this year. The recommendation tonight, staff has presented 2 available options for Board of Director consideration related to the construction contract of the East Office remodel. Option A, authorize the general manager to execute a construction contract with GLA Morris Construction, Inc. in the amount of $373,265.20 plus a change order allowance of 10% or $37,326.52 for a total construction contract budget not to exceed $410,591.72. Or option B, reject all bids received due to total bid prices exceeding estimated budget and consider it the updated 2024 facility master plan. With that, I'll turn it over to President Bender, and we'll be open to any questions you might have.
Great, thank you, Brian.
Thank you.
All right, any public comment on this item? Okay, seeing none. Public comment closed. Where are we at? FMP? Wait.
So I got a couple questions. I'm happy to
Okay.
start.
Do it.
We say it is over the anticipated construction budget. By how much?
So we didn't have an engineer's estimate for the project, but we were estimating that it's probably over budget by at least 2 times,
Oh.
Okay.
over our anticipated budget.
Well, that takes a bearing, isn't it? Let's wait.
So we thought we would be able to do it for 200,000 and approximately.
Approximately, yeah.
So, yeah, I mean, at the end of the day, nothing's ever going to get cheaper.
Nope.
So waiting is,
Case in point.
for the price to go down is not an option. The idea of waiting is the idea of, okay, we're going to be in this building for the next,
Building.
I see, for the next 8 to 10 years. I mean,
Yeah, as quickly as a facilities master plan can be created, approved, we decide we're changing locations, we have to find a location, we have to build a building, yeah.
or,
I'm with
you know,
you.
that's, yeah, and then we have to figure out how we're going to build a $50 million or more facility. So, you know, the question really for me with staff is, you know, understanding that the staff that are utilizing that space, and that space will be utilized by staff for the next 8 to 10 years, does it make sense? Is it necessary to function as an efficient operation to make those remodel changes? Or if we don't do anything, can it function properly for 8 to 10 years or more? I guess that's kind of where I'm at in this whole thing, because, as I said, nothing's going to get cheaper. So, and you saw the stratification of bids were extremely, you know, almost double. So, I mean, you know, to me, it's an idea, it's the idea that, is this a functional need of the district right now, for the idea that we're going to be here for a while?
Right.
So you're saying
Well-
that maybe it's well enough to invest the money now? It is, prices are going up.
Yeah, they're never gonna go down.
I talked to a contractor that's on the board of directors in the Kings Beach PUD. Which one is that one?
North Tahoe PUD,
Okay, that's North Tahoe?
her employer.
Well, you know, they're buying $1 million worth of materials and storing them.
Yeah.
Yeah, for in the future. I don't know if North Tahoe's doing that, because you order it and it might not be 6 months before you get it,
Or a year and a half.
or a year and a half, yeah. They're still waiting for stuff. He's doing some work in my little rental over there in Kings Beach. They put in a new water line, the PUD did, and we have to hook up the laterals. If we want water, because it used to come in the backyard, coming in the front yard now, the front street.
Got it.
And he says, the prices, I got a bid from him for this job, and it was $7,000. And the other day, he gave me the new bid. He says, everything went up 17%. The materials and everything else. It goes with the game.
Yep.
And it's gonna go up again in July. 17%.
Yeah.
So, maybe it's wise to do it now.
People are looking at my way.
Is there anyone over there? I'm done.
Yeah. No, it's, I mean, it is expensive for, something that's only 8 to 10 years. And
It could be longer,
or longer, yeah. It's,
at a minimum 8.
I haven't gone on a tour of the facility in a while, and I don't know if there are other options. Is it a need to have, or is it a need or a want? I know ideally you want all the space to be just the perfect space for what you need right then and there, and I know that we have added staff on, and done some remodels upstairs, but ultimately, we may be moving. I don't know. I'll leave it to you guys.
Yeah.
Or just to listen in a little
What happened
more.
about this may be moving, because Brian discussed it one night at a meeting.
We're still waiting for that plan to come back to us.
The what?
The plan that we may be moving because we haven't completed our facilities master plan yet.
One option
So,
maybe.
maybe, exactly.
That's
The
what we're
entire
moving?
facility. An option
No,
may be
it's
to move one facility and
option.
this facility stays in
Yes,
service.
and we don't
So
know. We
it's-
haven't weighed that yet. It's in the future, and again, we don't know what the future holds. But we do know
I
we
like
have
this
needs.
location better.
We have needs that currently need to be met. We have new
Yeah.
space, we have new staff, that needs space. It was covered in this. I'm leaning towards a Tony and for that matter, Joe, that things aren't gonna get less expensive. We're here for the foreseeable future. We have no other plan. We have no other plan at this moment, other than being in this building. So I think we should make our space livable and functional for the folks who work here.
Brian Wright.
Yes, great discussion and all fantastic points. That's particularly why staff presented it in the form we did. There's a decision-making here, and Director Laliotis is absolutely right that there is a immediate need or immediate operational need for these additional office spaces. It's kind of framed as the GM office suites, but it includes office space for our public information officer, strategic affairs director, our communications specialist, our district clerk's office, contract administration. And so it's definitely an operational need as the district has grown in staff, and some of our technical and professional positions, engineering, management analyst positions that have been really driven by increased regulatory requirements for this agency. And so the decision is exactly as it was framed, is the investment of potentially just over $400,000 in this new office space, a continuation of a kind of a longer-term plan that started back in 2019. Is that a wise investment, considering we're all kind of waiting also for a facilities master plan? The facilities master plan is evaluating how best to achieve the additional needs that this district has in terms of storing our resources in covered storage, the immersion of electric vehicle needs, other compliance that we're going to need for our facilities. And so there's definitely a need for more space long-term, but as you all pointed out, the master plan is evaluating several options. Expansion to another already owned district location, remodeling of the current location, not the building, but the larger facility, or a complete new location, trying to do an assessment of our needs and what's the most cost-effective way to achieve that. We'll have to consider that some of the remodeling that we've already aspired to complete, there were roadblocks there or are in some cases cost prohibitive because of the way this building was designed. So it is a medium-term investment to, in worst case, that we have to continue to put some money and investment in this building. Later on this year, staff's going to bring a proposal for approval for stucco replacement and some maintenance to the front of the building. We can't continue to let it, exceed its useful life just waiting for the facilities master plan. We have some paving infrastructure to replace and drainage stuff. So there is a continuing operational cost for this facility, and we will be here for definitely for a few years more. And I think there's a lot of value to continue to improve that office space so that everyone has a productive and, efficient workspace.
As you mentioned, there's a need for these new offices.
Yeah, the option B that Brian presented would, staff would reject all bids based on the cost being in excess of the budgetary estimate. We would then need to make some provisions, things like cubicle spaces and temporary walls, things of that nature, to create some, workable spaces for different positions in the district.
Like option A, investing in the building, investing in people's workspaces, be more productive, and have that space that you've indicated as a need. And then we can decide with the facilities master plan, whenever. There's not a lot more pressure on implementing that and making that a decision on where to go or how to utilize that facility master plan.
Yeah.
Because it buys us some time and staff gets the space they
Yeah, you
need.
have to maintain your building. I mean, we really don't.
Oh, and you also have to look at it as an investment in our people, and they
Yep.
have effective
100%.
and, appropriately designed and functional workspaces, they are better employees.
They're better
So-
employees. I sense a theme in this evening's
So I'll,
discussions.
I'll move staff's recommendation for option A only.
I'll second that motion.
Okay, roll call, please.
Director Aguirre?
I think we should say yes.
That's what we're, I'm gonna.
Director Harris?
Yeah.
Director Laliotis?
Yes.
Vice President Finn?
Yes.
President Bender?
Yes.
Thanks.
Thank you, Brian.
Thank you, Brian.
I think Brian
Yeah,
wanted us
thanks.
to say no because he doesn't want to have to move temporarily.
Okay. All right. Okay, and we've done 16, we've done 17. You want to do it again, Kim?
Oh, we will.
Rehash that out. All right, we've got some routine business. Consider approval of the February 7th and 3rd, 2024 board meeting minutes. Is there a motion?
Is there a public comment?
Oh, public comment, thank you. Public comment on the minutes? Seeing none. Director comments or questions?
They were brought up before, but then not approved, I think. Was there kind of,
There was an issue with.
there was an issue with them being brought up before, because February 7th was also in another agenda.
Right, I think that's why it got brought back.
That's what, okay. That's the only
There was a, I
item.
think it was a
noted.
date issue.
Yeah. Okay, I move to approve the board meeting minutes from, but I don't think, February 7th and April 3rd.
Correct.
But you know what, I wasn't at the April 3rd meeting. I don't
That's
know if that
okay.
matters, okay.
All good.
I'll second.
Okay, motion and second. Sarah, roll call, please.
Director Aguirre?
Yes.
Director Harris?
Yes.
Director Laliotis?
Yes.
I
Vice
didn't read
President
them,
Finn?
so I didn't-
Yes.
President Bender?
Yes.
Thank you.
Thanks. All right, treasurer's report. Fund balances for the month of February and bills that have already been paid for March. Joe,
Let's move to BAM then.
Okay, Joe moves. Public comment. Okay, no public
I'll second.
comment? Second. Roll call, please.
Director Guerra,
Yes,
Director Harris.
Yes.
made the motion.
Director Laliotis.
Yes.
Vice President Finn.
Yes.
President Bender.
Yes.
Thank you.
Thank you. All right. That's it for the regular meeting. We're going to hit closed session now, everyone.
Man,
9:25.
every time I turn the page, it comes.
Legal counsel exposure to litigation, 3 cases. All right, here we go. Thank you. Good night, everyone.